Yes, ma'am, we are live now.
Okay. Good evening, everybody. On behalf of the Tamil Nadu Federation of Obstetric and Gynecology Clinical Research Committee, for the today and tomorrow, we'll be having the topics on research methodology. It is actually long back. Foxy has started this PICSUP program. PICSUP means Program for Inculcating Culture and Scientific Inquiry and Pursuit. So this is being carried over by TNFOG so that it will be useful for both the postgraduates as well as for the assistant professors, and also for the clinicians. And I am very sure that this topic being a slightly a difficult one, we have tried to make it so simple so that each topic will be discussed for around 20 minutes so that we can take the details from that. And again, this will help to promote the research activity in our own field. So without any research activity, I am very sure the quality of work what we are going to give will not be a successful one. And this will help us to throw light and then get into the insight of every topic in obstetrics and gynecology. So on behalf of TNFOG as president, I welcome all the faculties and the members who have joined this particular program to this August meeting. So today, the first talk will be by research question, how to select these thesis topic, which is very important for the postgraduate, and the research types of research studies, and then study methodology, sample size, how many number of cases we need to choose, and how to do the literature search, and the statistics, which is very, very important from the clinician point of view. What is the statistics, what we can gain, what is needed to be applied to this research papers. So these are the important topics today we are going to discuss. And for this, we have learned chairpersons and speakers. Dr. Nikita Prabhakar from Abbots, Dr. Anureka from Salem, and then Dr. Hepzibah Kripamani and Dr. from Chennai, and Dr. Pasardi from Trichy. And we have chairpersons, Dr. Vidya Prabhakaran, Dr. Rajeshri, Dr. Saravana Kumar, Dr. Sampath Kumari, and Dr. Revati Janagiraman. Now let us start the program. Anything without God's blessings, it's not going to be very effective. Now, seeking the God's blessing in the form of Tamil Thai Valthu, we will start the program. Has Vidya Prabhakar joined? I think she is held up in
Emergency case, ma'am. She's not.
Okay. Okay. Now, let me introduce Dr. Nikita Prabhakar. She is from Abbott and Regional Medical Advisor for South. She has completed her MBBS from St. John's National Institute of Health Sciences, Bangalore, MBA from Annamalai University, Tamil Nadu, Health Research Methodology course from St. John's Research Institute of Bangalore. So, the topic she is going to deliver is the research questions. How to select your thesis topic. That is very, very important, because as far as the postgraduates are concerned, they have, when they are asked to choose any topic, they are actually, they don't know how, they don't have any idea. The topic should be chosen in such a way, it should be easily done, as well as the participant, you need to have all whatever is needed for that particular topic. It should be available easily in that particular center where she is doing the post-graduation. See, aiming something very high, like something like an artificial intelligence in a basic medical college, it is not correct. So you try to analyze the topic based upon the availability of the cases, so in large volume, so that it can be very easily done. At the same time, even for the research work, if you want to have the investigations done, it should be done in the same place. She should not go to some other area and all such things. It should be easily available and easily done. And topics should be of available, the cases should be available in plenty in that particular hospital. So now let us listen to Dr. Nikita.
Thank you, Ramani Devi ma'am, absolutely, for those kind words of introduction and absolutely relevant talk, because like you very rightly mentioned, framing a research question is the very basic and the very starting point of our research. So without any further ado, I would like to get on with the topic. I hope my screen is visible.
Make it full screen. Yeah, it's visible.
Perfect.
Go ahead.
Thank you, ma'am. So very good evening to one and all present. It's an absolute pleasure for me to be invited over by the TNFOG to once again take the topic of research methodology. It is my absolute pleasure to be here. I will be starting the topic, the research series, with the very first and basic framework of a thesis, which is formulation of a research question. So before that, what is clinical research? As we know, clinical research is something that is being conducted every day around the world because it is incremental for the advancement of medicine. If we are where we are today, and if we have the technological advances, the surgical advances, it is because of clinical research that is being conducted on an everyday basis. So as clinicians, it is definitely, most definitely our responsibility to not just practice these things which have been learned by others, but also add value to science, add value to medicine, add value to the healthcare science that we are a part of, by making sure to add value in the form of new clinical research, new findings to the field, because today you are practicing, tomorrow it is going to be the future generations. And what you learn today and add as value is going to impact so many millions of people with something as simple as your research paper. So with that introduction, let us talk about basically what are the main steps in executing a study. Now, the subsequent topics that will be covered, one of them is about research methodology, which I myself will be taking. So in that, we'll get into a little bit of details about what are the different steps. But in principle, the steps are, number one, defining the research problem and identifying what are the gaps, which are what are the questions that need to be answered in a particular area. Then going about to do your data collection by preset methods, and finally analyzing the data by means of statistics to bring out any sort of outcome or result of your study. Which brings us to the question of how to formulate a research question, which all begins with a good hypothesis. A hypothesis is very simple. I'm sure that all of us have heard this terminology, right? In and out, when we have approached our guides or when we've approached our mentors, we need a good hypothesis. So what is this good hypothesis? A hypothesis is nothing but a theory, a phenomenon, a thought that you have in your mind that you want to experiment on, right? That is a hypothesis. So before we get into a research, how to formulate a research question, let's understand what is a research question. In simple words, a research question is a question that either a study or a research project through the thesis statement is trying to answer, right? That is a very simple definition of what a research question is, which is why it is very important to have a very good research question. So where do we begin? Always, it is the beginning of a good thesis or a good research paper is with good and comprehensive literature review, right? This is the very basic step, because with this, you can come up with a good hypothesis. Now, sometimes, yes, we do have a hypothesis already in our mind based on which we go ahead and do literature analysis, but not always that we have ideas, right? Sometimes just going through a lot of papers, a lot of studies, a lot of articles, that itself gives us some inspiration or some hypothesis to pursue a particular field of study. Now, that in turn leads to a good research question. Based on the type of research question, you have different types of study designs. So to frame a good research question, these are a couple of questions you should ask. What is a research question, which we've already answered? Why do I need a good research question? How do I develop a good research question? How do I know it's a good research question? And what do I do with the research question? So something like a simple coffee house conversation itself can turn into a research question. Let's see here. So we have two scientific background individuals or two scientists who are having a conversation. So the first one says, peroxisome proliferator activated receptor gamma, which is PPAR agonists, show significant pleiotropic effects on vasculature as well as inflammatory pathways. Now, it says that means pioglitazone can act as anti-atherogenic as well as anti-inflammatory. Now, pioglitazone we know is an anti-diabetic medication, right? But again, this is scientific discussion. So this is something that this person has found out, saying, hey, did you know there is also anti-atherogenic and anti-inflammatory ways? So this brings the question, hey, why don't we test the effect of pioglitazone on vascular functions in patients with rheumatoid arthritis? So from diabetes, we're going to something altogether different, right? Because some studies have shown even this as a function of pioglitazone. And this, I believe, is one of the ways in which you can come up with a good research question. Now, before we understand how to frame the research question, let's understand the difference between a topic and a research question. I will just ask, is it possible for the students to unmute and answer, or will it be possible for me to know if they're giving responses? I don't think they're allowed to unmute, right?
No, ma'am, only chat, ma'am.
Okay, all right. So if you can enter it in the chat box, then I'll know that you're listening and we have, responses coming in. So simple idea. What is the difference between a topic and a research question? Very easy. Topic is very broad. This is a research topic. This is a research question. So topic is a complete area of interest. Now here, for example, I've taken PPH or postpartum hemorrhage. That would be the topic. Research question would be narrowing it down specifically to, for example, in my case, carbetocin in the management of PPH. So what I've done is I've taken a broad topic called postpartum hemorrhage, and I've segmented it to say, okay, which part of postpartum hemorrhage do I want to look at? Do I want to look at the epidemiological data, meaning to say who is more likely to get PPH? What are the parameters which are likely to be risk factors leading to PPH? Or am I looking at the diagnosis of PPH by means of investigations or blood tests or so, any other parameters, any guidelines, any scales? Or am I looking at treatment of PPH? If PPH happens, what is the treatment? Which treatment is better than which treatment? Or am I looking at prognosis after a woman has had PPH? Then what happens to her? What is her post-PPH life like? What is quality of life? What are some of the things that is affected? What about her mental health? What about her physical health? What part of PPH are you looking at? Right? So first step is identifying a broad area of interest or a topic. Then you can streamline down to like how I have come to a very specific question, which is carbetocin, which is a drug in the management of PPH. So out of all the broad headings, I have chosen management part of PPH. Under management part also, I have chosen the medical management part of PPH, right? So this is a simple example of a difference between a topic and a research question. Now, to answer the second question, why do I need a research question? Is it possible to explore an entire topic? impossible unless I dedicate my life, for example, to my example, PPH, right? Unless I dedicate my life to research in postpartum hemorrhage, it is not exactly plausible to cover the entire topic. Because like I mentioned, just in these few sentences, am I talking about epidemiology? Am I talking about risk factors, diagnosis, prognosis, treatment, medical treatment, surgical treatment, interventional management? There are so many things you can look at when it comes to just PPH. So it's impossible for me to cover an entire topic unless and until I dedicate my life to it. Therefore, multiple research questions also can be asked about any topic, right? Like I just gave the example. So it's better to focus on a specific research question. So it streamlines your research, it saves you time, it saves you effort, and it makes your research more better, and it makes it more focused. How do I develop a research question? You can either brainstorm ideas. See, this is something that happens when you're having a lot of scientific discussion, when you're reading up a lot, when you're studying a lot. Sometimes some ideas just pop into your head, right? So when you're reading also, read in a way that you try to find missing links. What is missing? What is something that people have not ventured into? What is something that I can do which will bridge this gap that seems to be there, blaring gap that seems to be there? Try to connect the dots. Or you can also organize your idea in the form of a sticky note or a concept chart. See, for example, I've taken here thyroid cancer, right? Like PPH, I've taken, for example, thyroid cancer. Now, under thyroid cancer, I'm specifically going into management. Chart to say, am I looking at surgery? Am I looking at radioablation? Am I looking at radiotherapy? If I'm looking at radiotherapy, then what am I looking at in terms of TKIs or genetics, DTC, recurrence, metastasis? If I'm looking at radioablations, am I looking at thyroglobulin, recombinant TSH? So by making this sort of concept chart, I'm trying to narrow down my research topic to something very specific as a research question. So how do I develop a research question? This is the flow chart of how to go about it. Like I mentioned, select the topic. Number one, I've taken postpartum hemorrhage. Narrow down the topic. How do I narrow it down? Like I said, do you want to look, which part of PPH do I want to look at? I wanted to look at management of PPH, right? Specifically, I wanted to look at medical management of PPH. Third step, list some questions. So I'm going to list some questions. How do I get questions? Of course, I should have gone back and done my research to see medical management. In medical management, what exactly is being done for the management of PPH? Apart from oxytocin, okay, seemingly there is misoprostol. Seemingly there is carbetocin, that is something new. Or there's something called heat-stable carbetocin also. Okay, what else is happening? So these kind of things, as you're doing research, you get some list of questions that come into your mind. Number 4, select one of those questions to say, okay, I would rather look at a newer drug comparing it to an older drug. So let me try and compare carbetocin with oxytocin. So you're selecting one question and focus on that question. Now, when I say focus on the question, it involves refining it and making it a very structured question or a research question. I will get to the structure part of it in the next couple of slides. So as I said, I cannot stress enough the importance of literature search, because it truly helps you come up with a good hypothesis, and also it helps you gain knowledge and understanding about what is going on in the field. Now, if I say PPH and I'm only going to think about management, I'm missing out on a lot of things. Or let's say, okay, I've decided I'm going to get into management. How many drugs, how many interventions, how many technological advances are there to manage postpartum hemorrhage? How will I be aware of it until and unless I do a good and comprehensive literature search? Thankfully for us, we live in a digital era. It is so much more easier to do literature search by means of Google Scholar, Yahoo Answers, or PubMed, or Embase, Scopus, Medline. No, there are so many ways for us to do this amount of literature search, to go through multiple papers. So I would urge everybody, whenever you're beginning a research paper, start with a good and comprehensive literature search. It helps. It helps if you have a hypothesis in mind. It helps if you have an area of interest that you're already looking at to sort of streamline your literature search. I'm not going to get into literature search in more detail, because I believe it might be a topic, and also it's a little bit of a deviation from our current topic. So I'm not going to get into that. But literature search itself is an art, and it's something that is very, if it's done the right way, it really yields a lot of results. Now, coming to how do I know that it is a good research question? Simple. Just see if it is a workable idea. How do you know if it's a workable idea? Number one is, before all of these flowcharts, you have your guides, you have your mentors, you have your colleagues, you have your seniors who have done research in the past, right? Run this idea through them, run it by them and ask them, is this a workable idea? Is this something that we can do in our hospital, in our state, in our city? Is this a workable idea? Apart from that, make sure to do a good quick search. This kind of study, has it been done in India before? Is it a plausible study? Is it something that is yielding any sort of outcomes, significant outcomes, or is it something that is a waste of time? Do a quick search. And number two is, is it the right size? Meaning to say, is it a topic that's much too broad or is it much too narrow? Because remember, keeping it broad does not help with coming up with a good research question and does not help in your publication. And too narrow will be very difficult for you to collect samples. So these are a few basic questions to help you understand whether your idea is a good workable research question. To that effect, there is a criteria called the finer criteria. This is how you fine-tune your research question to understand if it is indeed a good research question. What does finer stand for? Very simple. Is it feasible? Is it interesting? Is it novel? Is it ethical? And is it relevant? Finer, feasible, interesting, novel, ethical, and relevant. So some of the questions you need to ask, whatever you are pursuing as a research, is it a feasible option? Interesting. Why is this research question being asked? Has this been done before? Can the patient's rights be protected? Is it going to be ethical? And is it relevant? Meaning to say, is it really worth the effort, the time, and the money that you're going to invest into it? So this finer criteria is a very easy way for you to fine-tune your research question. Now, does the study have to add something new? If it does, wonderful. If not, not at all an issue. Because there are types of research papers. Seminal research paper is something that adds new contribution or new knowledge, something which is relatively rare as a finding, right? Whereas research which has been done before, you can add value to it. Okay, for example, if there's a study that has been done in another country altogether, and that kind of a study has not been done in India, you could do the same study here in India, because it might be a repeat of the same study, but you are increasing the confidence in the validity of the previous study. And more than that, you're able to extend or extrapolate the data to your population. So you're able to generalize the study or findings also to a new population or a new subset of patients or a new clinical context. So never be pressurized to always come up with seminal research papers. If you do, that's absolutely brilliant. But if you don't, you can always do research papers that add incremental value to existing papers also. Now, typically clinical research questions fall into two distinct categories. Questions which talk about effectiveness of a treatment, meaning to say, is one treatment better than the other treatment in terms of clinical effectiveness, like benefit and harm, or even cost effectiveness. Or questions about frequency of events, meaning to say incidence, prevalence of a disease, or any other clinical phenomena. What are the risk factors involved? What is the diagnosis or prognosis of a disease, or prediction of specific clinical outcomes, or any investigations on the quality of healthcare? So these are the different types of clinical research questions. So you can decide what route you want to take, and based on that, you'll have different types of study designs. So turning a research question into a proposal, these are some of the questions that will come up. What is the intervention that you are going to use? Is it a drug, or is it an assessment of a risk factor, presence or absence of a risk factor? What is the intervention? What is the outcome are you looking at? Are you looking at improvement of a particular parameter, like blood pressure medication, reduction in BP? Or is it risk factor, smoking leading to lung cancer? What is the outcome that you're looking at? What was the chance of bias or confounding minimized? What was the information collected, and was it collected in an ethical manner? Are your consent forms in place? Who are the participants? Who are your target population, or for whom you are conducting this study? Is it women in the age group, reproductive age group of 30 to 40 years? See, that is a very specific tag, right? So you need to have a very specific tag of participants. Who was the comparator group? Who are you comparing your group to? Is it with a placebo, or is it those who have the absence of a risk factor? What is your comparator group? What was the duration of the study? and what is the sample size, or what are the statistical tests that you have chosen for your analysis. These are some of the questions that come into play when you are turning your research question into a proposal, which is why you have a framework to construct a very good research question, because the research question ideally should answer all of these questions that are present on your screen. It should talk about who are the participants. It should talk about what is the intervention, who are you comparing, what is the comparison group that you are comparing the intervention with, and what is the duration of the study. These are some of the things that need to be covered in the research question, which is why you have a structure called PICOT or PICOT, where P stands for population or patients, I stands for intervention, C stands for comparator group, comparison between which two group of patients, O stands for outcome that you are looking at in your study, and T stands for time or duration, PICOT or PICOT. Now, I have taken the liberty to formulate a research question here. I was hoping it would be interactive, but since it's not, I will read out the question and I hope that you will get the answers right in the chat box. So, is 45 mg daily pioglitazone for 3 months effective to improve vascular function and to decrease disease activity in non-diabetic adult RA patients on stable RA standard of care treatment in comparison to placebo? So here we can talk about number one, who is the patient population? Very easy, right? It is the non-diabetic adult RA population who are already on RA standard care of treatment. That is your population. Can you see how specific it is? Then what is the intervention that I'm giving? Simple, 45 milligrams of daily pioglitazone. Comparator group, what is the intervention being compared to? Placebo. Outcome, what is the outcome that I'm hoping for? Vascular function improvement and to decrease disease activity. And finally, what is the timeline? It is 3 months. So if you notice here, is my PICOT in order? No, not at all. So do not think that just because I gave you a structure saying PICOT, your question doesn't have to be in that order, but you have to have all of these components in your research question in order to make it an effective and a good research question. Now, let me give you an example of good and bad research questions, okay? First example, how does social media affect people's behavior? Right, that is a bad research question. To refine it, to make it a better question, a good question would be, what effect does the daily use of YouTube have on the attention span of children under the age of 16? So can you see the difference? The explanation here, see, for example, in my first question, social media is very vague. How many applications are there on social media? Facebook, YouTube, Instagram, Snapchat, Twitter, so many things, so many, TikTok, and so many other things which I probably don't even know. So social media is very vague as a concept. So it's even the question on the whole, it lacks specificity. People's behavior now, who are the people that you are targeting? Which social media platform? And what behavioral aspect are you exactly looking at? So if you look at the second question, social media, you specified YouTube. People, I have specified children under the age of 16. Behavior, I'm specifically looking at the effect that it has on attention span. Right? So you have to have the more specific the question, the better is your research question. Now let's go to the second example. Has there been an increase in childhood obesity in the US in the past 10 years? Okay. Again, this is not an ideal question because you will very typically get, yes, there has been an increase, or no, there hasn't been an increase. Where is the room for you to go back and do the research? Rather, a good question would have been, how have school intervention programs and parental education levels affected the rate of childhood obesity among 1st to 6th grade students? So once again, what have I done? Childhood obesity, I have made it specifically, the population is children between 1st and 6th standard. I have spoken about a specific intervention to compare whether it is really helping, the intervention programs and parent education levels. Is it really helping the improvement of education, improvement of, childhood obesity rates in the specific population? So This gives you more room, gives the researcher more room to collect data, to do absolute in-depth data analysis and actually form an argument, which in turn can lead you to further discussions, further studies, further, papers that can come out of this. So that is a much better research question than the first very vague and bad research question. So this is some examples that I put together to help you understand some examples of a good and a bad research question. Now, coming to points to remember while creating a research question. Number one, ensure to remain updated on the current trends. What is the state-of-the-art research studies that are being done? What is the technological advances that are there in your field? You need to be updated, because let's say I'm talking about, for postpartum hemorrhage. Let's take my example of postpartum hemorrhage. Let's say I'm coming in and saying, Dr. Amni, I want to do a study on postpartum hemorrhage. I want to study oxytocin or effect, ma'am, effect of oxytocin on postpartum hemorrhage patients. How relevant or irrelevant is that? Because right now there are so many drugs, there are so many interventions, there are so many things which are there, which are much more state-of-the-art in treating postpartum hemorrhage. But if I'm going to come and say oxytocin, madam will tell me, Nikita, oxytocin is tried and tested already. It's nothing new that we can learn. It is not state-of-the-art. So I have failed. Why? Because I did not remain updated on the current trends, on the state-of-the-art research that's already been done, and what are the technological advances that are there. Number two, make your research question as specific and concise as possible to ensure clarity. Now, if you look at this previous example itself, how vague is it to say how much is there, increase in childhood obesity, rather than saying this specific intervention, how has it affected childhood obesity in this particular age group of children, right? So make it as specific and concise as possible so you have clarity. Now, aside from doing literature review, which I cannot stress on how important it is, make sure to seek the inputs of experts in the fields, in the form of your experts in the field, your mentors and your colleagues, because these inputs will not only help you with framing of a research question, but it will help you along your way as you're doing the study as well, because it will really help you from start to end, A to Z. There are so many places where these inputs, you have no idea, will really add value and help you along until you finally are able to publish your paper. So these are some of the important points to remember while you are creating a research question. Now, to summarize, number one, you start with a broad topic, like how I did, to say, I want to focus on postpartum hemorrhage. Do preliminary review of the related literature. So for me, I wanted to, in postpartum hemorrhage, I wanted to specifically look at management. So I have to go back and I have to do a review of what all literature is there with regards to management of postpartum hemorrhage, which is when I will have an understanding of what is being done, what is new, what is the latest advances, what are the new drugs, what are the pitfalls that are there when it comes to management. Maybe there's a knowledge gap that can be addressed. That all comes from doing a comprehensive and very good amount of literature review. Then narrow down your topic. So I've started with management. I've done a literature review. Now I can narrow down my topic and determine potential research questions about whatever I have narrowed down and jotted down as points. Finally, evaluate the soundness of your research question, which I've already mentioned is through the finer criteria. Look at, is it feasible? Is it interesting? Is it novel? Is it ethical? Is it possible to do it ethically? And is it really relevant for all the time and efforts that's being spent? And last but not the least, construct your research question. You can use the PICOT framework, which is a very simple and easy framework to put together your research question. PICOT, which stands for population, intervention, comparator, outcome, and time period or duration of your study. By doing this, you have effectively come up with a very good research question, and now you are ready to explore the different types of study designs to understand what would be the right study design for your particular research question. Thank you, and over to you, madam, to take up the next topic. I hope I was clear.
Nikita, I think it was a very, very simple, very comprehensive talk about how to choose a topic and how to narrow down to the questions. So you choose a broad topic and you go for the literature search. You find out what is new in that particular topic and you try to narrow down from there. Suppose like how you said from PPH, narrow down to the medical management. And in that medical management, what are the drugs that can be helpful. And you have very well said that finer criteria should be applicable, because that will choose the relevant thing in a simpler way, and again ultimately framing the questions which are relevant to that particular topic, framing based on this PICOT. So it's an excellent, it was an excellent simple talk on how to choose a topic. Thank you, Nikita, for your talk. Thank you. I think there is nothing in the chat box or in the question answer session. So, Madam, Revati Madam, unmute and talk. So, you want to add up anything, Revati Madam?
No, it is really nice and crisp.
Yes.
How to choose a topic. Nothing much. I wish only postgraduate should attend this.
Madam, it is meant for the postgraduates today, and we have got this TNFC credit points also for this methodology webinar. Yeah. Okay, shall we now move on to the second topic? Sagiti?
I'll take care, ma'am.
Yeah. The next chairperson is Dr. Rajeshri. She is a senior consultant, obstetrician, gynecologist from Capstan Clinic. She is a chairperson of Endocrinology Committee of TNFOG, member Endocrinology Committee of FOXI, member of FOXI, IFS, IMS, and IMA. And then area of special interest is high-risk pregnancy, preventive women's health, and she is a contributor to management of labor, and she has again also become one of the patrons for Tamil Nadu Federation of Obstetrics and Gynecology. Now we welcome you to chair this second session.
Thank you so much, ma'am. Thank you, ma'am. Thank you for the kind introduction. Sahiti, can I have the CV? So the second talk will be by Dr. Anurekha. She is a member of the Endocrinology Committee of FOXI since 2019. She's an active member of FOXI, ISAR, IFS. She's Assistant Professor, Governor Mohan Kumar Mangalam Medical College, Salem. Consultant IVF, ARMC, IVF Fertility Center, Salem. She has several awards to her credit. Dr. Nimisha Shelath Research Award by FOXI in January 2009. Best Oral Paper Presentation at Yuva ISAR 2016. Dr. Kamini Rao Orator, South Zone 2019. FOXI IAEC Sun International Traveling Fellowship 2022. She has more than 10 years teaching experience and more than 20 international and national presentations. She has around 15 publications in international and national peer-reviewed journals. We welcome you, Dr. Anurekha, to give your next talk. What is the type of study? Types of research study.
Thank you for your kind words and elaborate introduction. And I'm privileged to be here with all you are elated members of this TNFOG and Ramani ma'am and Revati ma'am here. Dr. Nikita has already done half of my job, I think. She has very well started the thing, and I'm very grateful to her for joining to us in the last minute notification. And so now I'll move on to my topic. Yeah. So my topic is on types of research questions. This is my first publication in Journal of Contraception, and I'll start my topic with this, and I'm very thankful to my guides and mentors at All India Institute of Medical Science, New Delhi, for having me this publication on my credit. This is PICSET, which we were discussing in our initial things. Of course, TNFOG and FOXI has been doing a lot of programs on behalf of PICSET. PICSET is nothing but program for inculcating the culture of scientific inquiry and pursuit. As Ramani ma'am rightly said, research is not only for PGs and assistant professors, it is for every clinician and every practitioner to fine-tune their skills and improve their knowledge. So at a glimpse, we'll have all these things in our topic. So everybody has to publish and flourish now. So what's the research question? Nikita has started it. I'll just continue with her. And what are all the types of epidemiological studies? Descriptive studies, analytical studies, observational studies, experimental studies, and what is Haynes success pyramid, systematic reviews and meta-analysis, what is the difference, and what are all the guidelines for doing the studies and acronyms. So I'll quickly move on to my topic. As Nikita said, research question, it should be relevant, it should be finer. India சொன்ன மாதிரி ஏன் என்ற கேள்வி, not only ஏன், not only why, you have to include when, what, and how in choosing a research question. So basically, there are two types of studies. One is descriptive and another is analytical. Descriptive studies involve the observations to measure the quantities. You start a study with the title of estimate the prevalence of. So that's a descriptive study. An analytical study is to intervene or compare, so determine the influence of one factor over the other in causing a disease. So that's the type of title which we have in analytical studies. So what is finer? Nikita's already told: feasible, interesting, novel, ethical, and relevant research questions. And this is a simple chart showing the classification. Descriptive studies includes case reports. Case reports, especially for a rare or unique manifestation which has been observed in your practice. And case series, when you observe a larger group of rare disease patients, like an origin of syndromes or a common way of delineating the clinical picture of a particular disease. And cross-sectional survey is also a type of descriptive study in which you observe a cross-section of a population, a whole population at a single point of time. Prevalence studies are based on this. You cannot prove the causation in a cross-sectional survey. And what are ecological studies? When an entire race or an entire group of people are being compared with another group. So entire race is the unit of the study. It's an ecological study. You can't arrive at an individual level information, but you can just say that the Western population is having a more risk of photosensitivity than an Indian people. So like that, an ecological study goes on. So analytical studies are basically observational and experimental. And what are all the observational studies? Case control, cohort, cross-sectional. We have already told. So analytical studies, it is based on the nature, like you don't intervene. But experimental studies are the other way. You have to intervene, and the intervention will be in one group versus the in one group and not in the other group. Or you can intervene with one factor in one group and the other thing in other group. Like you have a randomized control trial or a non-randomized control trial based on this, or a community intervention trial where you intervene for one community and you don't intervene for other community, and some pragmatic clinical trials or experimental studies where you introduce a new drug and you go on studying its dosage, side effects, and the therapeutic benefits. So what is a case control study? It's the simplest of all the studies, all the epidemiological studies. It's obviously a retrospective study where the disease has already occurred. You have the case and controls at the start of the study, and you go on with the study of the exposure of the variables, where the cases may have a certain strength of exposure to the variable, and the controls may have a certain strength of exposure to the variables. You divide them as exposed and non-exposed. And cohort study is a type of prospective study. Here you start on with the exposure or the factor which can cause a disease. You follow up the people, and then you end up where a certain part of the exposed people will develop disease and another will not develop a disease. So a cohort study is basically a longitudinal or prospective study. You start with the exposure and you end with the outcome. And odds ratio is the interpretation of the case control study where you have an AD by BC, that is the incidence of the disease among the exposed by unexposed. That is, odds ratio goes on like the strength of exposure in the diseased population versus the strength of exposure in the undiseased population. When relative risk is the interpretation of cohort study, it is incidence of disease in the exposed divided by incidence of disease in the unexposed. What are the advantages of case control studies? As I said, you can study rare disease, and there is a long latency between the exposure and manifestation. You can just start on with the disease, and then you can retrospectively get the data of exposure. So case control study is one that is suited for a long latent period of exposure and disease. And it can be done over a short period and is very economical, inexpensive, and you can study multiple potential causes for the disease. And what are the disadvantages of case control studies? There is a recall bias. Not everyone will be able to recall the strength of exposure to certain factor or influencing thing. And there is a difficulty of validation of information. You cannot rely on the history which is being given, and some may not be able to recall, or some may not be able to reveal an exact exposing factor. And by definition, it is concerned with one disease, and you cannot go on with a result or a factor causing a disease for more than one disease. And you cannot provide information of incidence rates in the disease, and it is an incomplete control of variables. Some people may have an exposure and they cannot quantify, or they cannot estimate the strength of exposure of certain factors. And there may be an control group which is very difficult to be chosen from the same population, because if you want to estimate a disease because of environmental pollution, the pollution will be the same in almost the pollution will be the same, and the exposure will be the same in nearby cities or nearby places. So you cannot have an appropriate control group sometimes. And the methodology is hard to comprehend for non-epidemiologists, and the interpretation may be difficult. Whereas in cohort studies, you start with the exposure, you follow up till the disease, you can study multiple outcomes related to the specific exposure. So this is a very big strength of cohort studies. And you can calculate the incidence rate or the absolute risk of the exposure to the disease. And the method is easily understood, and you can study a relatively rare exposure, but not an extremely rare. And the biggest disadvantage of cohort study is if the exposure and the disease manifestation is going to be very long, you cannot practically follow the patient from the exposure to the disease. And there is a type of cohort study called historical cohort study, in which you are trying to overcome this, but this is the biggest disadvantage of all the cohort studies. And in my next slide, I'll be telling on the retrospective cohort study. So this is one study done for especially these type of cases where there is a long latency period from the exposure to the disease. And of course, the prospective cohort study is the usual one. And one more type, ambispective cohort study, is the one where you start anywhere between the latency period from the exposure to disease. But this is not a typical cohort study, and interpretation becomes very difficult. நம்ம யூஸ்வலா சொல்ற மாதிரி கோழி முதல்ல வந்ததா முட்டை முதல்ல வந்ததா அப்படின்ற மாதிரி இது. And what is a cross-sectional study? Cross-sectional study is a population study. You take a case and control from the same population at a same point of time, and you get the history of exposure of certain variable in both the controls and the cases. So what is the biggest advantage of cross-sectional study? You carry out a large-scale study at the same point at a very short period, and you can have a large number of cases also. But again, the causation or the validation of the results will be a difficulty. So now coming to the experimental studies. As I said, this is an artificial exposure, or the exposure is planned by the investigator. You can have a randomized or a non-randomized clinical trial. These are the studies born in 20th century, and before that we didn't have any experimental studies. And there comes the methods of randomization also, like simple randomization, block randomization, stratified randomization, and covariate adaptive randomization. What is simple randomization? You just take a coin and toss it, or you take a dice and keep a number for some 2 or 3, fix it for the study population. That's a simple randomization. And what is a block randomization? You divide the entire study population into blocks. Like in this picture, which I had shown, you divide it into 6 blocks, and from each block, I take 2 persons for the study. for the study group, case group, and the other 2% will be for the control group. This is one type of randomization called block randomization. So another one is random selection of blocks, where you adjust the selection for the exposing factors or the covariables. Like if a person in a block has obesity, and another person is of a normal weight. So you adjust them for the covariables or the confounding factors. So that is called covariate randomization, covariate adaptive randomization. And stratified randomization is you use a computerized randomization table for the selection of the population, study population and the control population. So these are all the types of randomization, and stratified and covariate are the usually recommended ones. And what is bias? This is the biggest thing to be chosen, to be taken into mind when you do a randomized control trial, because a randomized control trial avoids the bias. And what is quasi-randomized control trial? As I said, in a simple randomization, like tossing a coin or taking a dice and you select your study population, or you just take a thing like if some person is entering into your clinic and you take every third person or every sixth person, like that. So every third person or every 10th person or every fifth person, like that. So this is just a quasi-randomized trial, and quasi-randomized trial has a higher risk of bias. And this is a picture showing the Cochrane interpretation of a study having all these bias represented as green, yellow, and red. Green is the amount of low risk of bias, and the yellow is unclear risk of bias, and red is high risk of bias. Like in random sequence generation, the selection bias for these studies, like this is all the studies which has been taken in the review, in this particular review. These studies has red has higher risk of bias, and yellow has unvariable, unclear risk of bias, and green has a low risk of bias. So this is in every Cochrane interpretation, you can see such a page, and this is just an indication of the bias at one glance in the studies which has been taken into the review. And so now I move on to the hypothesis formulation. So with all these types of studies, suppose if you want to do a study, and I'm giving this example of, does GnRH analogs administration before hysteroscopic submucous fibroid resection benefits? So this is what I'm going to research. This is what I'm trying to do. So this is a hypothesis. So what is a hypothesis, and how we have to do, and how we have to go on with the hypothesis? For a descriptive questions, you don't have to have any hypothesis. Descriptive questions, you just have to like estimate the thing which is already present. So this is a thing which is coming under an analytical study, right? So what type of analytical study I want to go on? Like, I need tomatoes. I can buy it from anywhere, the shops, right? But it depends on like whether I want to store it in fridge, or whether I want to take 1 kilogram only, or whether I want to take 2 kilogram only, and whether I want to have my purchase done for a lower cost or higher cost, like that. So how you want to do a study depends on the type of the study also. Like your study gets published according to your type of study, and your study has an influence according to the type of study done. So with this hypothesis, if I choose the PICO, what is PICO? Is patient population or problem, I is intervention or indication, C is comparison or control, and O is outcome. So with this study of GnRH analog in submucous fibroid resection, what is the PICO? Patient population will be women with symptomatic submucous fibroid, either type 1 or type 2 fibroid of FIGO types. And intervention, I have to give GnRH analog, 3 doses at 4 weeks interval prior to the hysteroscopy. And who will be the control thing? The controlled patients will have either a placebo like a lignocaine or distilled water, something like that. And what is the outcome I want to study? I want to have a complete fibroid removal after a single sitting of hysteroscopic fibroid resection. And I want to review them after 6 weeks for a symptomatic improvement. So this is the PICO for this particular hypothesis. So now this is a study which is done for the same purpose. And this is mentioned in the methodology that Consecutively numbered opaque sealed envelopes were prepared at King's College Hospital NHS Foundation Trust using a computer-generated simple randomization sequence. The envelopes were securely kept at nurse's office at gynecology outpatient clinic. I'm just reading off the thing which is there in the box. Patients were randomly assigned to subcutaneous injection of the placebo or goserelin and randomization of patient administration of it. So with this, what and all has to be inferred from the materials and methods? First is the randomization. They have randomized, okay, so they have generated a simple randomization sequence with a computer, and they have an opaque sealed envelope. So this indicates they have minimized the bias, and there is a placebo, so they do have a control group, and clinicians and patients are blinded. So they have written like randomization of patients, administration of injections were done by staff nurses who are not part of the trial, and both the patients and clinicians involved in the trial were blinded to the group allocation. And same operator, whether the same surgeon has operated all these patients, that also matters. So these are all the things which has to be taken into account when you write the materials and methods. And this indicates the study has been planned meticulously and it is a good study for a review. What is the importance of doing a randomized control trial? Again, this is the research pyramid, and in this pyramid, we do have all these editorials, case reports, case controls in the base of the pyramid. So as you go on at the top, quality improves. Like the cohort studies come somewhere here, and randomized control trials are above that, and then comes the critical appraised articles and critical appraised topics, and systematic reviews are at the top of the research pyramid. And what is Haynes success pyramid? Whatever you do, like there is a randomized control trial or any experimental study, these are primary studies, okay? And the secondary studies, what are the secondary studies? And our secondary studies are nothing but synopsis, or which comes under the meta-analysis or systematic reviews, okay? So the primary studies is any experimental study or an observational study, and the secondary studies are meta-analysis or systematic reviews. And this is one example. Cochrane Central Register of Control Trials has published one study of dose reduction of antenatal betamethasone in women at risk of very preterm delivery. This is a beta dose trial, as it is named on, and this was published on 31st March of 2021. Can you see that this is a dose reduction trial in antenatal women? Okay, so antenatal women who are at risk of preterm delivery are having betamethasone. So this is one trial. The other one, this is one trial, this is one study, that's all. And the other one, the below one, is a Cochrane database of systematic reviews, which has published a study, which has published a systematic review. Different corticosteroids and regimens for accelerating fetal lung maturation for babies at risk of preterm birth. Can you see the difference? The above one is a trial, beta dose trial. They've just taken into account the dose strategy and what is the ideal dose for that particular group of antenatal women. So this is what the intention in first one, earlier one, the above one. And the below one is a systematic review. They've taken a large number of studies in which a different corticosteroids has been used. Like for some, they have been given betamethasone, and some there is dexamethasone, and some at a dose of 6 milligram, and some at a dose of 8 milligram, and different regimens have been given. So this is a review. They've taken all these factors together. So this is the advantage of doing a systematic review, and that is why these are kept as secondary studies, and that is why they're kept in the topper area of the success Haynes pyramid. And what is a systematic review and what's the meta-analysis? The basic difference is a systematic review just puts together all the studies, and they collect and summarize the evidence and summarize the conclusion, okay, for a pre-specified criteria. And what is a meta-analysis? They just take the data which has been there in all those articles, like they put together and they group together all those number of patients, they pool together, and they do a statistical analysis for all those patients. Like one study has 20 study population and 30 case group, okay, 30 control group. And another study has 30 in the study group and 20 in the control group. So what they do is they put together all those 50 and they do a statistical analysis again. So this is the meta-analysis. And meta-analysis obviously has an edge over the systematic review, and Studies which carries a bias are the culprits when you infer a meta-analysis review or infer a meta-analysis or a systematic review. And is there any guidelines having an importance in when you come to talk about the studies? Yes, obviously. Again, I'm going to the sixth experiment. Guidelines are the synopsis of synthesis or in the topper portion of the premise. Okay, so this is one guidelines by our own ICOG Foxy for induction of labor at term in older mothers. So similar to this guidelines, there are a lot number of guidelines which is published by ACOG, RCOG, and so on, and you must be aware of it. And these are certain acronyms which are basically rules which is guiding the studies, guiding the proper methodology for doing studies. IMRAD is nothing but Introduction, Methods, Results, and Discussion, which is the basic structure of text of any paper. And TACAR, it is again the same. This is the integral part. For some, they group it as TACAR, like they include the acknowledgement and references. And there are certain guidelines like the International Committee of Medical Journal Editors. They have put ICMJ, they have put some uniform requirements in the website, and they have put some guidelines for the manuscript, for submitting the manuscript in the standardized format. And consort guidelines, that is the consolidated standards of reporting trials developed by ICMJE, is for the randomized control trials. Consort guidelines has to be followed for doing any randomized control trial and publishing it. And STROBE, it is similar to the consort for observational studies, and MOOS is for observational studies in epidemiology, especially when you are doing a cross-sectional study for a larger group. These MOOS guidelines has to be taken into account. And quorum is the quality of reporting of meta-analysis. And there are some guidelines for lab studies also, like STARD. STARD is studies designed to assess the diagnostic test. So these are acronyms and synonymous to the rules. So with this, I end my talk. I think I've done justice to my topic. And one slide I want to just discuss. This is a table showing the outcomes of Pearl 1 and Pearl 2 studies. What is this 1 and 2 study? What is this Pearl study? Are you aware? This is one landmark study which is done for establishing the role of ulipristal acetate in fibroid. And what is Pearl 1 and Pearl 2? We have done up to Pearl 3 and Pearl 4. So what is 1, 2, 3, 4? These are phases in clinical trials and objectives. Phase 1 is a study done to know the safety or acceptability of any drug. And phase 2 is to know the dosage and schedule and regimen of that particular drug. And phase 3 is to establish the clinical benefits or the effectiveness. And phase 4 is the post-marketing surveillance. So this is one table which is showing the Pearl 1 and Pearl 2 results. Here, there is one placebo for comparison, and UPA 5 milligram, that is ulipristal 5 milligram, has been compared with ulipristal 10 milligram. So this is what their conclusion is. So this is Pearl 1 and this is Pearl 2. Okay. So with this Pearl 1, they've just studied the dosage of 5 milligram versus 2 milligram with the placebo. And with this Pearl 2, they've studied the clinical benefits like control of uterine bleeding and shrinkage of fabric. So that is what I wanted to tell. So phase 1 is just for safety and acceptability, and phase 2 is for long-term safety, early efficacy and dosage and schedule. And phase 3 is for effectiveness and clinical benefits. Phase 4 is for post-marketing surveillance. So I end my topic. Studies are nowadays a must. Publications are the footprint of research. And whether you do a research or not, it is like you have to constantly update. And if you want to publish or not, and that is what I meant to say, like publish and flourish. So there is no shortcuts. You have to do it every day, and you have to do a research in your practice, whether you're a practitioner or in a medical college or a teaching setup. It's an integral part of your profession. Thank you.
Thank you, Dr. Anureka. It was really a brilliant talk. You have actually explained in detail the different types of studies in the given time and very precisely about each type of study. So as I understand, you have descriptive and analytical, and different types under what is under descriptive and what is under analytical. And the systematic reviews and meta-analysis come above that. right? It
Yes.
comes about that in the Haynes pyramid, and then you have the guidelines in it. That is the order in which we have.
Yes.
So this doesn't come under type of study. The systematic review and meta-analysis doesn't come under your type of study. It's something above that where it analyzes
Yeah.
a group of studies.
Yes.
Yeah. Thank you so much. It was really very well done. You have really done justice to your time at the top.
Thank you.
Thank you. Thank you. Thank you. Ma'am, Ramani ma'am.
Lastly, we'll go with the next topic.
Welcome, Sampath.
முதல்ல வந்துட்டேன் madam. First speaker கே வந்துட்டேன். Screen அப்புறமா.
தெரியல எனக்கு.
Anureka has done a good job.
Excellent job.
அவள நிக்கிதாவும் நல்லா தான் பேசினா. நிக்கிதாவும் நல்லா தான்
ரெண்டு
பேசினா.
பேரும் நல்லா
Also did a
பேசுறீங்க.
very good job.
பட் நம்ம ஆடியன்ஸ் தான் 34 இருக்காங்க. என்ன பண்றது? இவ்வளவு நல்ல டாபிக் வைக்கிறோம். 34 மக்கள் இருந்தா என்ன பண்றது? Anureka has taken so much efforts to make this program. Anyway, we will invite Dr. Epsiba madam. வந்துட்டாங்களா?
அடுத்த டாக் எப்சிபா மேடமா?
ஆமா.
இல்ல சரவணகுமார் சார் போட்டிருக்காங்க. சரவணகுமார் சார்.
அடுத்த டாக் எப்சிபா மேடம் இல்லையா?
Chairperson is
Ma'am,
Saratkumar.
Saravana Kumar sir, chairperson.
Chairperson.
Again, Dr. Nikita.
Nikita Prabhakar is the next topic.
Yeah, next
Yeah.
topic, Nikita.
I think we'll start off with a
Ramani ma'am, you can introduce.
Or you want me to?
Yeah, Dr. N. Saravanakumar, who's a professor and HOD of Annapurna Medical College. He did his MBBS from Bellary, MD from MMC Chennai. He was a secretary for OG Society of Salem, organizing secretary for Foxy South Zone Conference, which was a great hit. Then currently consultant at Malar Maternity Hospital. Initiated and trained young gynecologists in operative laparoscopy in Annapurna Medical College. Field of interest is high-risk obstetrics and gynec endoscopy. Over to you, Dr. Saravanakumar.
Thank you, madam. Thank you for your wonderful introduction. And it is Nikita Prabhakar again for this study methodology and sample size. Actually, study methodology gives us an insight into how a particular thesis can be put into test and for its effective outcome. Again, for the sample size, many times what happens is the PGs take a very large sample size, which may not be feasible or it may not do justice for their job. And if it's a very small sample size, again, it won't be unscientific. Over to you, Dr. Nikita Prabhakar, to talk about the topic.
Thank you, Dr. Sarvana. I'm just going to quickly share my screen. And yes, it says it's not allowed. Yeah. I hope my screen is visible on large. Yes?
Yes, ma'am. Correct. Yes, ma'am.
Yes, Dr. Nikita.
Thank you once again for the kind introduction, sir. I will get to the content of what I'll be talking about in terms of research methodology. Now, in terms of, yes, the content, I'll be talking about the definition of what research methodology is, what are the different types of research methodologies, what are the components of research methodology, a little bit about sampling as well, data collection procedures and data analysis methods. Now, what is the definition? Definition of research methodology is basically it describes the techniques, the procedures which you use to identify, analyze information about a specific research topic. So from A to Z, the entire process involved is called a research methodology. So this is the process by which researchers design their study so that they can achieve their objectives using the specific research instruments. Now, in terms of what are the types of research methodologies, broadly, there are different types, but to understand them from a simpler perspective, I'm going to quantify it as 3 important types of research methodologies. Number 1 is quantitative research methodology, which focuses more on measuring and testing numerical data. So in this type of research, it helps you understand in the testing the causal relationships between various variables and in making predictions in generalizing results to a wider population. Qualitative research is the second type. Here, you examine opinions, behaviors, experiences of the people. So what you do is you collect, you analyze words and textual data, and this is then further used in exploratory research where the research problem being investigated is not clearly defined. So to understand what exactly is a problem, you do a qualitative research and then you can follow it up with a quantitative research to make it more impactful. Then you have a mixed methodology, which, as I mentioned, It uses the characteristics of both a qualitative as well as a quantitative research methodology in the same study. So this method allows researchers to validate their findings and verify if the results obtained during, for example, the qualitative search is backed up by or complemented by the quantitative research. That would be a mixed methodological research methodology. Now, what are the different components of a research methodology? A good research methodology has the following key components: research design, sampling, tools or statistical tools that you use for your research, the data collection methodologies, how do you analyze your data, and finally, ethical consideration. Now, statistical tools is something I believe which is already the upcoming topics, and even ethics is something that will be covered in the subsequent sessions tomorrow. So, and I'm going to talk about, and research design again is something that's already been covered by Dr. Anureka, where we spoke about the different types of clinical study designs. So I will talk a little bit about sampling. So what is sampling? Sampling is an important part of research methodology, and it involves selecting a representative population to conduct the study so that whatever inferences, whatever findings you have for this population, you can make statistical inferences about them and estimate the characteristic of the whole population based on these inferences. This is why sampling becomes extremely important. Now, there are two types of sampling designs in research methodology: probability sampling and non-probability sampling. So, probability sampling, as the name suggests, there is a fixed method to go about doing probability sampling. So, in this sampling design, a sample is chosen from a larger population using some form of selection. There is some form of selection, of random selection, but there is a fixed methodology in place so that every member of the population has an equal chance of being selected. You're not prefixing it. There is an equal chance of being selected. Now, under this probability sampling, there are different types: simple random, systematic random sampling, stratified sampling, and cluster or multi-stage cluster sampling. Let me talk about each of the different types. In simple sampling, here, let's just assume that each member of a population, this is done in a smaller segment where your population is relatively small, let's say a district or a town or just a hospital. Here you can, let's say, number each individual and randomly select any of the numbers who will be your sample, who will be representative of the larger population. In simple words, a lottery method of sorts. So here, that is the simple random. Okay, you're just choosing random numbers here. In systematic random, once you have numbered your population, you have a systematic means of selecting, meaning to say every third individual will be selected. So number 2, followed by the third individual, number 5, followed by the third individual, number 8, followed by the third, number 11, and so on and so forth. So there it is random, but at the same time, there's a systematic way of taking the sample. So here you can use it when your complete list of the population from which the sample is being drawn is available. Like I mentioned, for example, you're conducting a study in a hospital, in specifically the inpatient ward of the obstetrics and gynecology department of let's say SRMC Hospital, Chennai. Okay, you're specifically choosing a particular ward of patients. We can 200, you have numbered the patients, and in that you're doing systematic random sampling of every 4th patient I'm going to select, right? So this is another form of probability sampling. Then you had stratified sampling. Now, in stratified sampling, you have, first of all, let's say if you see, if you've noticed, I've color coded my samples, right? So between 1 to 12, some of them are blue, some of the members are red, some of the members are green. Let's assume that the colors are some particular characteristic trait, right? Now, if I want my sample to be representative of the genuine population, it should be exactly reflecting how this population looks. So if you look at my large population of 12 members, there are exactly 1/4 of them being blue, 1/4 of them being green, and half of them are red. So even my sample has to have half of them being red, 1/4 of it being blue, and 1/4 of it being green, right? So this is why stratification becomes an important part of sampling. Then comes multi-stage cluster sampling. So let's suppose now again I have 12 individuals and I've paired them up as 2, 4, 6, 8, 10, and 12. And each of those 2 will form a cluster. Now, where is this useful? Let's say you're doing a large countrywide survey. So you can make each division or each district or subdivision into a cluster and pick up specific clusters in order to do your sampling. So for example, I have 6 clusters here, cluster 1, 2, 3, 4, 5, and 6. And I've decided to choose cluster 4 and cluster 6 very random. So there's a randomization. Yes, there is clusters, which is easy for me to pick up. And when I'm doing something like a nationwide survey, which involves a large number of participants, this becomes a much more easier sampling method. Then you have the differences between, so I've covered the different types of probability sampling. Now, why is stratified sampling useful? I'm going to naturally, because it is more representative, as I mentioned, of the larger population. So if you look at my sample here, this exactly looks like my large population, where half of my population sample is just like, is red, just like my population. Quarter of it is blue and quarter of it is green, just like my representative population. So stratification becomes very useful. So I've taken the liberty to put the differences between cluster sampling and stratified sampling. So if you look at the population, let's say my population would be all the diabetic patients of West Bengal, right? That is my population. In that, I am looking at either clusters or strata. If I was looking at cluster na, I would be looking at 20 clusters in the 20 districts of West Bengal. Other one, the cluster sampling. Stratified sampling, it will be 20 strata according to the 20 districts. I have created different stratas in the individual districts. Yella district and the strata apply pannuven, and I have 20 strata. Now, to obtain a sample, 20 in cluster sampling, in the 20 clusters, I will choose randomly 5 clusters. Cluster number 3, cluster number 7, cluster number 12, cluster number 15, and cluster number 19. I'm just choosing random 5 districts or 5 clusters out of my 20. If it was stratified sampling, I will say I'm going to choose 500 people or 5,000 people from each of the 20 districts, right? So here, what happens in the sample of the cluster sampling, I will take every patient in the cluster. So if I have 20 districts and I've chosen 5 districts, and the 5 districts all patients will be part of my sample. Whereas in stratified sampling, I've exactly taken 5,000 people from each of the districts, meaning it's 5,000 into 20, exactly 1 lakh diabetic patients. So you can understand in this itself how a little bit more systematic a stratified sampling turns out to be. So all of this we were talking about is probability sampling. Coming to non-probability sampling. Non-probability sampling involves feedback based on researchers' sample selection capabilities, and there is no fixed selection process. If probability sampling, there was specific methodology in place. It was either a simple random selection, or there was systematic random selection. Otherwise, you have stratification, and then from strata, you're selecting randomly. But here, there's nothing of that sort. The researcher himself will choose. She will choose who she wants to enroll into the study. So based on this, there are 4 types of non-probability sampling methods. Number 1 is convenience methods, where you are selecting participants who are most easily accessible because of the geographical proximity or because of the availability of a particular time. Let's say you're working as a postgraduate in a hospital. So for you, convenience sampling would probably happen because you're going to the OBG department and you're choosing patients who are most easily accessible to you. So that is a convenience sampling. Now, purposive sampling is your participants are selected at the researcher's discretion, meaning he knows exactly the purpose of the study and he'll understand the target audience and accordingly make sure to choose the sample population. Snowball effect is, it is like a snowball, meaning it starts with 1 and it grows little by little. How? Because the already selected participants, they use their social networks and so on and so forth to refer more patients to the study, saying this is the particular study that's happening, come and enroll. And they will go to other potential participants and enroll patients. That is snowball effect. And finally, quota, meaning just as the name suggests, while designing the study itself, the researcher itself will decide how many people with what particular characteristics he wants to include as participants. Now, keeping those characteristics in mind, it will help him choose who are the people who are most likely to be providing insights into this particular topic. So, for example, I'm trying to understand, let's say, I'm trying to do a study on career satisfaction among, HR professionals. okay, or no, finance professionals. I'm trying to understand career satisfaction amongst finance professionals. Now, who will be my target population? So when I'm thinking already, I have to target only finance populations, right? I cannot, just because I'm doing a non-probability sampling of just walking into any and every corporate office, going to the finance department, doesn't mean I can just go to any company and ask any person. I am specifically looking at finance individuals. So whilst designing the study itself, I have an idea of what characteristic needs to be there in my sample population. That is called quota non-probability sampling. So that is, in simple terms, the difference between probability as well as non-probability sampling. Now, coming to sample size, as Sir rightly mentioned, sample size does become very significant in your study because it depends upon a number of factors, which I will get into, but your study becomes a lot more simpler or easier depending on your sample size calculation. You cannot have too many patients recruited in your study. At the same time, you cannot have too less number of patients. So you need to have the right amount. Why? Because it improves the precision of your study. It gives your study adequate power. Now, let's say you have a very good study, but you don't have sufficient samples to back up your, study. So it is not going to give you enough power. Economic viability, meaning to say, if you're recruiting too many patients and your study is oversized, you're wasting your resources for no reason. Ethical consideration, again, if it is oversized and you're giving unnecessary treatment to, a large group of patients, it's very unethical. Likewise, if it is something like a very good treatment and you've recruited, let's say 1,000 patients, and in that 500 are control and 500 are treatment, you're actually denying some very good treatment to 500 people. So again, that is another ethical consideration to look at. At the same time, you should not undersize your population for, let's say you have a drug or a product which is not going to come across with very good results, and you haven't had sufficient amount of population to give a good inference. Unfortunately, there's no knowledge advancement, and probably there might be detrimental effects for you continuing to use that product. So ethical considerations is something also that adds value in terms of sample size collection. So what are some of the factors that come into play when you're looking at sample size? The type of study. Your sample size formula itself differs based on the type of study that you're conducting. What is the type of primary outcome? What is the power of the study? What is the expected variability between subjects? What is the clinically important effect size? What is your expected attrition rate and availability of subjects? These are a few factors to consider when you look at sample size. Now, sample size, there is a particular formula in place. Again, it varies. It depends on multiple factors like variance and standard deviation and standard error when it comes to your study. So there are, depending upon the type of study designs, there are different formulas and different means to calculate, or different methods to calculate sample size. Ideally, I know that your statisticians will help you with sample size calculation. It completely depends. There are softwares also now that are available wherein you put in a particular prefix data and it will throw out what will be your ideal sample size. I'm not going to get into what is the formula because, like I mentioned, depending on the type of study, there are different formulas. I will rather move over to data collection methods. Now, what are the different data collection methods? That also depends upon the type of study that you're being undertaking. Whether it is a quantitative research paper or qualitative research paper, your data collection methods are different. If it is a quantitative study, you have, the data collection method depends on your sampling, on interviews that you conduct, on observations, on document reviews, on surveys, questionnaires. Whereas in a qualitative research, you will need one-on-one because you're looking at qualitative textual data, right? Content. So one-on-one interviews, literature review or record keeping, focus group discussions, or qualitative observations itself. These are the different methods by which you can collect your data depending upon the type of research methodology you are undertaking. And data analysis, once again, the data that is collected during the course of the study has to be analyzed, right? Only then you can get some kind of meaningful insights. So this analysis method also depends upon the type of research methodology. Now, if you have a quantitative research methodology, then the method includes statistical analysis to analyze numerical data, because like I said, quantitative is more of numerical data, right? So again, to analyze numerical data, you have specific statistical analysis applications that you have to entail. Now, under this quantitative research analysis also, there are two types. There is descriptive analysis and there is inferential analysis. Descriptive analysis, basically, it is used to describe the features of your data. If you presented this particular data in a meaningful way, it gives understanding to your research paper. So I'll explain. For example, measures of frequency, count, percentage, frequency, percentage, something as simple as percentage. For example, let's say percentage of patients in Chennai with who are H1N1 positive, or let's say COVID positive, percentage of women or children in a rural sector who are asthmatic compared to the urban sector. Percentages, these are very significant. It's a small number, but it gives you so much of insight and so much of understanding to the data that you have collected. So descriptive analysis can be represented in the form of measures of frequency, like count, percentage of frequency, measures of central tendency, like mean, median, mode, measures of dispersion or variation, like range, variance, or standard deviation, measures of position, like percentile rank or quartile rank. Now, inferential analysis is used to make predictions about the larger population based on the analysis of data that you collect from the smaller population. So this analysis, typically, you try to understand the relationship between your various variables. So the types of inferential analysis include, number one is correlation analysis. Here, it is to very typically understand the relationship between two or more variables. Cross-tabulation is to analyze the relationship between multiple variables, not just one or two, but multiple cross, relationships. You try to understand between multiple variables. In regression analysis, you try to understand the impact of independent variables on the dependent variable. In frequency tables, you try to understand the particular frequency of data. And analysis of variance, here you test the degree to which two or more variables differ in an experiment. That is analysis of variance. So this is a type of inferential analysis, which is under the quantitative research methodology data analysis. Then you have qualitative research data analysis, which involves inductive method of data analysis, where you test your hypothesis after data collection. The methods include content analysis, qualitative, right? You're getting one-on-one interviews. So content analysis, meaning you determine the presence of certain words or concepts in texts. Narrative analysis is analysis of content from sources like interviews and surveys, and the stories and opinions which are shared by the subjects or the people. These are used to answer the research question, right? Discourse analysis is for analyzing the interaction between people, considering the social context, considering the lifestyle, considering the environment in which this interaction occurred, and analyzing that is called discourse analysis. Grounded theory is involving the hypothesis creation by data collection and to analyze and explain why a phenomenon occurred. And thematic analysis is to identify important themes, important patterns that you see in the data, and use these to maybe address an issue. These are the different ways you analyze a qualitative research data. Now, to choose a research methodology, some of the important factors to consider are, number one is, what is your research objective? What is the aim and what are the questions? Because these, like I mentioned, will help you structure your research design. Number two, ensure to review existing literature so that you have an idea what are the gaps of knowledge that are there in the existing topic or in the existing area. Number three, check the statistical requirements that are in place. Number four, sample size, which can often determine the feasibility of a research methodology paper in the first place. Is it feasible or not? Constraints in terms of time, in terms of geography, in terms of resources will help you identify or define the appropriate methodology, because you might have a paper that's absolutely brilliant, but if you do not have the required amount of time to execute this paper, then again, that becomes a very big constraint in choosing that particular research paper or thesis. So these are some of the factors that you have to consider when you are choosing a research methodology. So in order to summarize, let me talk about first, what is a research methodology? It is a process by which the researchers design their studies so that they can achieve their objectives using the selected research instruments. Then we talked about the types of research methodology, which is your quantitative research, qualitative research, and mixed method research. Then we spoke about sampling. What is the definition of sampling? It is to have a population in your study which is very representative of the larger population. For example, if I'm doing a study on something related to women's health, like obstetrics and gynecology related study, naturally all my patients have to be women, right? It cannot be that I have random men and women who are recruited into my population. Likewise, if I'm doing a study on adolescent health or the impact of, let's say, hormone replacement therapy in a very young age group, right? In the perimenopausal age group, naturally, I have to specifically have samples in my population who are representative of this larger population of perimenopausal age group, right? So it is important to understand what exactly your research question is. It will help you understand a little bit about what type of sample also you need to collect. So based on that, we spoke about types of sampling. We have probability sampling and we have non-probability sampling. Probability sampling is where you have specific fixed methodologies to collect a sample, like simple random, stratified, random systematic sampling, and cluster sampling. Whereas non-probability sampling was more of where the researcher chooses people for a one-on-one questionnaire or surveys wherein you have recruited patients of convenience, based on convenience, based on quota, based on snowball effect and purposive effect. Then you have data collection methods. Data collection methods again vary depending upon whether it is a quantitative paper or whether it is a qualitative paper. And finally, we spoke a little bit about data analysis methods, which again depends completely upon your research methodology. If you're looking at a quantitative research paper, your analysis, it can be either a differential analysis or it can be an inferential analysis, which is different means of analyzing numeric data. So you have your mode frequency, your percentile ranges, standard deviations, or inferential analysis also, like correlation, regression, cross-tabulation, and so on and so forth. Then we spoke about qualitative research papers, which have to be analyzed in a much different method when compared to your quantitative data analysis. So with that, it is a brief understanding of what is a research methodology. It is the A to Z of how you go about conducting a research paper. So with that, I will say thank you, and I hope it was concise and to the point when it comes to what is research methodology and what is sampling.
Thank you, Nikita. It is a clear and easily understandable point-by-point coverage of a difficult topic, and with workable examples. I think what we see more commonly is if they don't, as you told, if they don't structure the research project, they probably run out of time or they have other constraints, especially like the instrument failure or loss of kits.
Yes.
And sometimes they do extrapolation of a small data.
Exactly.
And also they do failure, they fail to randomize for their convenience. So unless until we properly structure it out and do a proper sample, it's very difficult to do a justice to whatever research we are doing. Thank you. Thank you very much.
எப்சிபா மேடம் ரெடியா இருக்கீங்களா? நான் இன்ட்ரோடியூஸ் பண்ணிடுறேன். ரமணி மேடம் ஏதோ ஒரு 2 வார்த்தை சொல்வாங்கன்னு பார்த்தேன். ரமணி மேடம் டீ குடிக்க போயிட்டாங்கன்னு நினைக்கிறேன். எனிவே
இல்ல சம்பத், நான் ஒரு எமர்ஜென்சி கேஸ் வந்ததுன்னு பார்த்துட்டு வந்துட்டேன். நோ ப்ராப்ளம். ஐ எம் வெரி ஹாப்பி டு வெல்கம் மை டீச்சர் அண்ட் I role model Dr. Hepzibah Kripamani for this wonderful program, and she herself has been a good researcher with PhD and DSc and so many other qualifications and multiple awards she has won, and she is very active in Menopause Society of India and past IMS chairperson for Education Committee, and currently she is a joint treasurer, and she has received so many awards. Yes. And yes. And everybody in Tamil Nadu, not only in Tamil Nadu, all over India knows very well about Dr. Hepzibah.
Thank you, Ramani. Yes, we'll move on to the topic. Yes, madam, literature
search.
Yeah, at the outset, I should thank the TNFOG and a special word of thanks to Dr. Ramani and Dr. Sambat Kumari for giving me an opportunity to share my thoughts.
Epsiba ma'am, muted.
You are able to see my slides, isn't it?
Yes, madam. Yes,
Okay, okay.
there is.
Yeah. When the topic is given to me, few questions came to my mind. That is, what is literature search? How can we search for existing literature? Where can we do a literature survey? What is meant by literature review? How to review the literature selected? So coming to know what is literature search, it is a systematic and well-organized search from the already published data, identify a breadth of good quality references on the specific topic. The main purpose of thorough literature search is to formulate a topic of your interest by evaluating the available literature with an eye on gaps still amenable to research, further research. As the selection of topic was done by Nimita, she was talking how to select. So it need not be a new topic. It can be the same topic. You must try and find out what is the gap so that you can do your search also. So the literature search is a crucial stage in the process of writing a literature review. It helps to identify if research question has previously been explored. It uncovers all relevant knowledge and research methods related to the research question. You can acquire new
Lost connection.
Epsiba ma'am. Epsiba ma'am.
Calling her and calling her.
இல்ல நெட்டு போயிடுச்சு உங்களுக்கு.
அதான். For 2 minutes, wait பண்ணி பார்க்கலாம். Suppose if she is not getting the connection, shall we move on to the next talk? Then once when she is okay.
Dr.
Yeah,
Parthasari, Dr. Parthasari sir.
If
Not
he's available, we can move on.
Yeah.
இல்ல
Parthasari sir.
ma'am. I'll call him.
Okay. மேடம் சொல்லுங்க. அதான் பாக்குறோம். நாங்க பார்த்து. சரி. No issue. மேடம் ஏதோ கொஞ்சம் ப்ராப்ளம் போல இருக்கு. அதான் டாக்டர் பார்த்சாரதியை பேச சொல்லிடலாம்.
இதோ கால் பண்ணிட்டு இருக்கேன் மேம்.
ஓகே.
Ma'am, Pathsaradhi sir available.
Ah.
Irkaru. He said.
Ask him to join them.
Yeah. He's already joined, ma'am. Irkaru.
Okay,
Doctor.
fine. Fine.
Chairperson. யாரு chairperson?
Nanda.
Revati ma'am தான்.
Okay,
problem.
madam.
No problem. அவர் ஜாயின் பண்ணிட்டேன்னா அவரோட சிவி போட்டு ஸ்டார்ட் பண்ணி போயிட்டே இருக்கலாம் நம்ம.
அவரு ஏதோ மைக்கு ஒரே ஒரு நிமிஷம் சொன்னாரு.
மேம் ஐ அம் ஆன்லைன் மொபைல்ல கனெக்ட் ஆயிருக்கேன் மேம் லேப்டாப்ல இருந்து கனெக்ட் பண்ணிட்டு இருக்கேன் ஜஸ்ட் 2 minutes மேம் நான் பிரசன்டேஷன் ஸ்டார்ட்
Okay.
ரமணி மேடம் என்ன ஆச்சு அதுக்குள்ள எனக்கு ஒரு கால் வந்தது எப்சிபா மேடம் என்னாச்சு
எப்சிபா மேடம் வந்து
Network problem.
இன்டர்நெட் ப்ராப்ளமா மேம்? கனெக்ட் பண்றாங்க.
She will join. She will
அதுக்குள்ள ஒரு கால் வந்து பேசிட்டு வர்றதுக்குள்ள
join.
எப்சிபா
Sir
மேடம்
முடிச்சோனே join.
சரி
ஹாய் சம்பத்.
ரேவதி மேடம் குட் ஈவினிங்.
குட் ஈவினிங்.
மேடம் ஃப்ரைடேக்கு வந்து வேற யாருமே இல்ல மேடம் நீங்க மட்டும்தான்.
சரி
மேடம் என்ன
பாக்குறேன்.
பண்றது? சாந்தி குணசிங் மறந்துட்டேன்னு சொல்றாங்க மேடம்.
சரி நோ ப்ராப்ளம். We will manage.
மேடம் இல்ல மேடம் சிஎம்ஏக்கு ஜட்ஜிக்கு வந்து நான் சாந்தி குணசிங்கும் கார்த்திகா பிரபுவும் போட்டிருந்தோம்ல மேடம் பாவம் மறந்துட்டு வேற எதையோ ஒத்துக்கிட்டாங்க. அதனால ரேவதி மேடத்தை போன மாசமே சொன்னாங்க எல்லா மாசமே என்ன உட்கார வச்சுட்டாதேன்னாங்க. அதனால இந்த மாசம் மட்டும் உட்காருங்க மேடம் சொல்லிட்டேன். ஜட்ஜ மாத்திக்கிட்டே இருக்க வேண்டாம்ல. அவங்களுக்கு நான் ரிமைண்ட் பண்ணிருக்கலாம் சாந்தி மேடம்க்கு விட்டுட்டேன். நான் போன் பண்ண அன்னைக்கு அவங்க ஆல்ரெடி ஊருக்கு கிளம்புறாங்க.
ஸ்ரீபிரியா இப்ப டிஎன்எம்சி கிரெடிட் அவர்ஸ் எப்படி வாங்குறதுன்னு கேட்டிருக்காங்க பாருங்க.
போடுறேன் மேம்.
ஓகே
இல்ல நம்ம வந்து ரெஜிஸ்ட்ரேஷன் நம்பர் அனுப்பிச்சா ஆட்டோமேட்டிக்கா நம்மளுக்கு வந்துரும் இல்ல இமெயில்ல.
வராது பணம் கட்டணும்ல.
அது இருக்கு.
பார்சாதி சார் ஜாயின் பண்ணிட்டாரு.
எஸ் ஸ்ரீபிரியா அவரோட சிவி போட்டிருப்பா நம்ம இன்ட்ரோடியூஸ் பண்ணிடுவோம். Okay. Good evening, dear friends. I'm really happy that Dr. Ramani has organized this wonderful research methodology workshop in which we have got very, very interesting topics for both days. And actually, I have conducted a PICSUP program with Dr. Mahendra Parikh Foxy thrice, 2 times at Madurai and once at Chennai. It was very, very interesting. But always statistics is something far away from physicians' interest. Those who are very poor in mathematics only choose medicine. That is what we used to say. But you know, one thing, statistics is very, very important. And here we have got Dr. Pathsaradhi to talk about the importance of statistics in clinical practice. You know, statistics plays an important role in clinical practice in the way of when we plan, when we design, when we collect data, when we analyze it, when we have to draw some interpretation, and in reporting the research findings. For all these things, we need statistics. Only then we can put it in an authoritative way. And now I welcome Dr. Pathsaradhi, who is Associate Professor, Department of Community Medicine, KAPV Government Medical College. And he did his PG in All India Institute of Hygiene and Public Health, Calcutta. His key areas of interest are epidemiological studies, biostatistics, disease control, and medical education. He has got teaching experience of more than 10 years, and he has published more than 15 research articles. He has participated in monitoring and evaluation of various national health programs, pulse polio immunization, evaluator for sub-national certification for elimination of TB, and so on. He is trained and certified in fundamentals of biostatistics. He is a resource person for research methodology and biostatistics workshop conducted by Tamil Nadu MGR Medical University for medical faculties and postgraduates. And I think he is an apt person to talk about statistics in clinical perspective. Over to you, Dr. Pathsaradhi. Hope you are able to.
Am I audible, ma'am?
Yeah. Please share your screen.
Yes, just.
Hepzibah also has joined. Anyway, let him finish and.
Finish, madam. Let him finish.
Yeah. Yes, sir. Make it full screen. It is visible.
Yes. Is it visible in full screen mode, ma'am?
Yes, sir. Thank you.
Yes, thank you. So at the outset, I thank the TNFOG for giving me this opportunity. So let's see. Actually, this is a workshop of statistics. So it's a full day workshop, but I'll try to be concise. I'll be touching upon most important topics to give you an overview of what should be done when you start with statistical analysis. So that is where we are going to start. So this is my plan of talk today. So we'll be talking about terminologies and types of variables initially. Then we'll be proceeding towards the types of presentation of data. What are the different ways in which you can present data? And then we'll be moving on to the measures of central tendency and measures of dispersion. Following which we'll be touching upon data distributions and different tests of significance or hypothesis testing. So first, let's see about the different terminologies. So first of all, statistics, we all know it's the science of collecting, organizing, and summarizing data primarily to draw conclusions. So we like to have different kinds of conclusions from the large amounts of data we do from research studies. So this is what we are usually do. So, but what is the difference between data and information? Information in the plain forms are just values. If you just collect values and if you just enter it in a master chart or whatever is there, that is just observations. So that's information. But then what is data? Data is when you make it in a organized, structured form, it becomes a data. The singular form for data is datum, and the plural is usually data. So there are different types of statistics. The two types usually used is descriptive statistics and inferential statistics. As you have seen in the previous sessions, we have two types of research questions. Descriptive question for a descriptive studies and analytical question for an analytical type of studies. So for all the descriptive type of questions, we do rely on descriptive statistics, and inferential statistics, we do it only for analytical reasons. Nowadays, almost all the studies are usually they require some kind of inferential statistics, because we do not stop with descriptive studies alone. We usually have the analytical component also. So these are the things we usually do. In descriptive statistics wise, we just present the data, we just describe the data. We just give them, these are the data I got from the study. But what about inferential statistics? We have already a hypothesis or a research question in hand. Then we test whether our hypothesis is true, whether it is significant or not significant. Then we give the point estimates, we give confidence intervals. This is my mean values. These are the confidence intervals for these values. To take it to the next level, we also do prediction in the form of regression analysis. So linear regression, logistic regression, these kind of regression analysis, why it is needed is a change in one variable, how it affects the larger variable. We have a lot of risk factors for each disease. So a change in small amount of change in one risk factor, how it impacts the development of a particular disease. So these kind of things can be predicted using regression variations or predictive analysis, which is the higher end of inferential statistics. So next we'll proceed about regarding the types of variables. So when you see the types of variables, there are a lot of confusions in types of variables. Because statisticians use different terms, clinicians use different terms, the research scholars use different terms. But primarily, you should be aware that there are two broad categories of variables. So this is very basic, because many people go wrong in this place itself. So if you go wrong in this first step, then everything will be going wrong. So in Tamil, we usually say Mudal Konal, Mutrilum Konal. So this is the first and foremost step. You should know what kind of variable you are dealing with. That is very important. So first is, we have two types of variables, which are two categories, which is quantitative. Another one is called qualitative variables. Like quantitative research studies and qualitative research studies, we also have quantitative variables and qualitative variables. So quantitative variables means, quantitative, the other name is numerical variable. Qualitative, the other name is categorical variables, qualitative. So there are two types in quantitative variables, which is continuous or discrete. If there are uninterrupted numbers are there, then it is a continuous data. But if the data is whole number, then it is a discrete data. Say, for example, we'll see some examples in the next slides. Then comes categorical data. Categorical is qualitative. You give groups of data. So there are two types, nominal and ordinal. Nominal, you remember names. If the data itself is some kind of name, so some kind of male, female, gender, blood group data, A group, B group, O group. So if it is named, there is no meaningful order. In that case, it is a nominal data. If there is meaningful order, if there is ranks between the data cases, then it is called ordinal data. Mild anemia, moderate anemia, severe anemia. If you have a meaningful order, then it is called ordinal data. So depending on the type of data, your data representation will also change. And also the type of graph you are going to use will also change. And the type of statistical test you are going to use also will be changed. And the type of analysis, what you are going to do, everything will be different. So for first thing, you should be clear in what type of variable is this. Nowadays, with the advent of AI, artificial intelligence tools, ChatGPT and all, if you know what kind of variable is yours, you just ask the artificial intelligence tool what kind of test, what test should be done for this kind of variable. It will give you the answer. So you need not scratch your head for what kinds of tests and all. So that is why you should be clear in what type of variable is this. So broadly, we classify the variables into quantitative and qualitative, otherwise numerical and categorical. Then comes continuous data or discrete data. Then the same continuous data will be interval scale or ratio scale, and categorical data will be ordinal or nominal scale. So the examples. So as I said, for nominal scale, these are the examples. For ordinal scale, mild, moderate, severe, or the Glasgow Coma scale, or the classifications wise. Then what about the numerical scales or the quantitative data? The quantitative data is divided into interval scale or ratio scale. So just remember, a ratio scale means 0 means nothing in the ratio scale. 0 has no value. Whereas in interval scale, if you say temperature is 0 degrees, it means there is a value. 0 degree exists in temperature. pH of 0 exists in interval scale. So for those things where 0 has meaning is interval scale. If 0 does not have any meaning or it means nothing, then it is ratio scale. So this is broadly the types of data. What is binary data in categorical? Binary means only two outcomes. Yes or no, disease present, absent. Then that is called binary outcome variables. That is also a type of nominal variable, but because there is only two categories, we call it separately as binary variables. So to be clear, quantitative data, qualitative data. Under quantitative data, we have discrete data, continuous data. Under qualitative data, we have the other name is categorical data. We have nominal data or ordinal data. In the OG examples wise, if you see, the nominal data can be dichotomous, either disease present or absent. Categories, more than two categories wise. If you see, the nominal data can be blood group wise or anemia, types of anemia, microcytic, macrocytic, normocytic. These kind of anemias are also nominal data. Then coming to ordinal data, if you stage the carcinoma of cervix into different stages, then there is a meaningful order. Then that is an ordinal data. Stage the Apgar score, then it is also an ordinal data. Then comes health status. So all these kinds of data, if there is meaningful order, it is ordinal data. Coming to discrete data. Discrete data are whole numbers. The number of pregnancies will be definitely an whole number. There cannot be point values. The number of previous cesareans, the number of risk factors for each woman, the parity of women, all these things are whole numbers. So what about continuous data? Hemoglobin value for gestational diabetes mellitus, if you measure the blood sugar value, the birth weight of the babies measured in 2.5 grams, 2.8 grams. So when there is point values, these are called continuous data. So now that we have seen the types of data, now we are going to, I'll just ask, you can answer in the chat box. So what is the first type of variable? The hospital number, hospital 1, hospital 2, hospital 3. You can answer in the chat box. Or otherwise, you can unmute and answer. Okay, not much answers in the chat box. So, okay, let me share with you the number of types of the hospital numbers is nominal data, because you're just giving names of the hospital. Then comes culture test, whether it is positive or negative. So either we have only two outcomes. So it is called a binary data. Okay, a binary is also a type of nominal data. Then comes smear result. If you take a pap smear and you ask for a negative or uncertain or positive result, in that case, it is called an ordinal data. We have a meaningful order. Low birth weight, if it is present or absent, if you take birth weight in a continuous number-wise data, then it is a continuous data. If you take 2.7, 2.8, in that case, whether low birth weight present or absent, it comes as a nominal data or binary data. What about vitamin A status? There is a meaningful order, so it becomes a ordinal data. The number of episodes of malaria, it's a whole number, then discrete data. Age, continuous data. So all these kinds of different kinds of variables, you can see the same variable. If you take hemoglobin or BMI, if you give point values, it becomes a continuous data. If you classify and group it together, you are converting a continuous data into a grouped data. That grouped data may be a nominal data, or if it has a meaningful order, it will become a ordinal data. If you convert the hemoglobin value into mild anemia, moderate anemia, and severe anemia, it is a ordinal data. So in statistician's perspective view wise, he may be asking you, what is your dependent variable? What is your independent variable? So this is what we do in statistics wise. Statisticians usually, even nowadays, when you deal with regressions or all, they ask you, you should be clear in what is your dependent variable. Remember always, the dependent variable is nothing but your outcome variable. Whatever the main disease of study you are studying is the dependent variable. It is dependent on a lot of factors to be present. The risk factors are considered as independent variables. So this you should be clear when you are doing inferential statistics. They may be asking you. So next, the independent variables are again called as factors or covariates. When you control the independent factor, when you experiment with one risk factor, then it is considered a factor. When you do not control it, the risk factor, it is called a covariate. When you deal with softwares like SPSS, it will ask you factorial analysis or describe the factor or enter the covariate, it will ask you. So there you should be clear what is a factor and what are the covariates. So after we have seen with some terminologies and these things, we are going to present about the presentation of data. Either you can present the data in tabular form or charts and graphs. So the simplest way always to present the data is tabular form. So the tabular form wise, if you see, this table is not at all okay. There are many deficiencies here, but let's see, this is not an ideal table. So to be there, all the tables should be numbered properly and there should be a title there. Apart from the title, there should be a meaningful value. Even if a layman looks at your table, it should be clear in what you are conveying, what message you are conveying through that table. And also many times, if you are using data from different sources, you have to cite the source also. If you see here in the bottom, they have cited the source also. So that is very, very essential. So this is another example table. Here you can see in the brackets, the number of cells, number of persons is indicated for each cell. This is very much essential when you present the data. For many journals, they will be asking you write the N, because if you give column percentages, you have to write the N on the top. If you give row percentages, you will give the N here. And if you are using any abbreviations, you have to explain the acronyms below the table. What are the different types of graphical representations? Many times we use these kind of things: bar charts, histograms, line diagrams, pie charts, and box plots and stem and leaf plots. So bar charts, usually we use bar charts for categorical or numerical discrete data. So the country-wise representation is mentioned here. Nowadays, we use a lot of these stacked bar charts for each year or for each group of studies, like our cases and controls. If we are comparing, we use these kind of stacked bar charts. What is histogram? Histograms are primarily used to study the distribution of data, whether it is normally distributed or not. Because only for a normally distributed data, we will be using parametric tests. Otherwise, we have to use non-parametric tests. This is histograms. Then comes frequency polygon. When this advantage of frequency polygon is you can plot more than one histogram graphs in the same chart. That is why we use frequency polygon. Then comes line diagrams. Whenever you want to plot time series over the time, over the years, or over the months, how the number has changed, then when you want to indicate the time series, you have to use line diagrams. What about pie chart? You want to depict the data as a part of a whole. The entire whole is 100%, and out of the 100%, how much is contributed by each this thing. So in that case, we will be using pie charts. What about box plots? When we have large data, large sets of data, there we usually, if it is not normally distributed, then we use median, and in that case, we will be using this 5-point summary. So what are the 5-point summary in box plots? The minimum, the first point is the minimum, the last one is the maximum. The center is the median, not mean, median. Then comes the quartile 1 and quartile 3. These 5 points are plotted together to form this box and whisker plot. This is the box and these are the whiskers at the both the ends. So minimum, maximum, median, and this is quartile 1 and quartile 2. The other type of plot is scatter plot. you can plot the relationship between two continuous datas using scatter plot. One, if you are studying the relationship between height and weight, or you are studying the relationship between systolic blood pressure and age, both are continuous variables. So if you plot a scatter plot, you may get a linear representation. So this kind of linear relationships can be studied between different variables, and you can plot a scatter plot matrix also. So now you know how to represent or depict the data in a tabular form and visual form as charts or graphs. Now we are going to see what are the measures of central tendency and measures of dispersion. The usually used measures of central tendency and dispersion for descriptive statistics is mean, median, mode, standard deviation, and interquartile range. Whenever we use mean, we always use the measure of central tendency as standard deviation, mean plus or minus SD. When we use median, we are supposed to use interquartile range, median plus or minus IQR in the brackets. That is interquartile range. Interquartile range is nothing but Q3 minus Q1. The distance between quartile 3 and quartile 1 is interquartile range. When to use mean and when to use median? If you have a lot of outliers, then always outliers means huge. I mean, the majority of 90 to 95% of the data will be in one range. Suddenly, 2 or 3% alone, huge values or very low values. So if you take mean in that case, 1 or 2 cases alone will influence the entire data. So that is why you have to see the histogram, you have to see the visual depiction. If you see the visual depiction, if you see there are a lot of outliers, then you should not use mean. You are supposed to use median, and you are supposed to use the interquartile range as the measure of central dispersion. So for mean, we usually use standard deviation. For median, we use interquartile range. Remember this. So with this, we are going to enter about data distributions, type of data distributions and tests of significance. So we already knew for quantitative data, there are two types, continuous data and discrete data. If the numbers are whole numbers, if the numbers are discrete data, then we have these types of distributions: binomial distribution, Poisson distribution, and hypergeometric distribution. So in these type of data distributions, the statistical analysis is a little bit different and a little bit complicated. We always, if the distributions are not not nearing normal distributions, then we always recommend you to consult a statistician to help you in analysis. Because for normally distributed data, the data analysis is easy and it is stringently you can use parametric tests. Whereas if the data are not normally distributed, then you will be getting into trouble. Doing a parametric test for a non-normally distributed data is viewed seriously nowadays in many journals. So when you write for journal articles for the journals, just a trained eye or a statistician can easily identify what type of data is. By just looking at your mean and standard deviation, he may have an idea whether this data is normal distributed or not normally distributed. Only if it is normally distributed, you can do parametric tests like t-test, ANOVA test and all. Otherwise, you have to do non-parametric tests. If your data is not normally distributed and if you are doing parametric tests like t-test, then he will ask you, what test did you do for testing the normality? There are two types of tests. One is Shapiro-Wilk and Kolmogorov-Smirnov test. You have to do those tests and report. Before proceeding to the test of significance, you have to write, my variable was normally distributed as we did this test, and based on the test, we are declaring parametric test. This is what you have to mention here. So I'm not going into the details of this normal distribution curve. Just remember, most of the continuous data we are dealing with in science, if you collect enough data and you plot it in an axis, then most of the data usually follow this normal distribution. Okay. Say, for example, if you plot the hemoglobin levels of 1,000 cases of pregnant women, and if you plot it in a diagram like this, then the center one is called the mean. Mean is considered as 0. And these are all standard deviations. So mostly 95% of the women's data will be between -2 standard deviation to +2 standard deviation. Say, for example, if your mean of your study may be 9 grams, and if your standard deviation is 1 grams, 1 gram percentage, then in that case, 95% of data will be from 95% of the hemoglobin values of the women in your study will be from 7% to 11%. So this is what is called normal distribution curve. because many things in the science, in the data distributions usually follow normal distribution. This is where we consider in science, first of all, we see most of the statisticians, they have designed these statistical tests for normal distributions. So assume you are doing a study on huge populations, then whatever you plot for the entire population will follow normal distributions. If there are some variables which do not follow normal distributions, so the first and foremost step before doing for inferential statistics is you have to check whether your variable is normal distributed or not. That is very, very important. So this is very important slide. If you see here, there are two types of things that you have to do. First of all, we describe the data in many studies. In any study, you first describe the data. You give the descriptive statistics. So you measure, you describe the data, whether it is categorical data or continuous data. If it is a categorical data, you give the proportion, the prevalence of a study or percentage if you mention it. And if it is a continuous data, you either use mean or median. If it is a mean, you give a standard deviation. If it is a median, you use interquartile range. Then comes the visual depiction. We usually give 1 or 2 bar charts or pie charts or clustered bar charts. Then if it is a continuous data, we are going to give different kinds of histograms, box plots, and these kind of things. So this is for visually depicting the data. Then what do you do? So here, now coming to the statistical tests. So you can take a snapshot or I can share this presentation with you all. So depending on the type of data, see, this is not meant to be discussed in half an hour session, but I'm giving you this flowchart so that you can go back when you are doing with your own analysis, you can go through and what type of test to use when. Okay, so these are all tests which can be used. So only if there are normal distribution is there, you can use these kind of red coded tests are called parametric tests. Always try to use parametric tests because parametric tests are stronger. It gives serious meaningful assumptions, and try to avoid non-parametric tests. So in some cases, even after all the measures are taking all the measures, you cannot use parametric tests. Only in those cases, you have to go for non-parametric tests. So if you are continuous variable, if you are handling continuous variable, and if you are having only one group, then you use one sample t-test. And if you are handling two samples, then you use 2 independent sample tests. And if you are using before and after test, you do a paired t-test. And if you are dealing with more than 2 groups, then you handle one-way ANOVA test. And you can do Pearson's correlation or linear regression. The same counterpart I've given you here. And for categorical data, usually we deal with non-parametric tests. I've given you all the non-parametric test list here. For survival analysis, where the time to event, time taken for the outcome to occur, when we are studying those kind of things, we usually have here plot with log-rank test and Cox regression. So this is an overview or outlay of the different types of tests you can use. So you can go back, you can verify the internet, or you can ask any artificial intelligence tools or any of these things. You can have this flowcharts, and based on this, you can determine what kind of tests to use when. So there are usually statisticians will say univariate analysis, bivariate, and multivariate. Univariate is only dealing with only one variable. Bivariate is relationship between 2 variables. And multivariate is when we are doing typically regression analysis. We usually ask for multivariate analysis. There is one more thing now usually we do is, if your data is not normally distributed, then what we try to do is we convert the non-normal data into normal data by doing transformations. Okay, either you can take log of all the values and you can apply parametric tests, then you can respond. So this is a little bit higher level of statistics. So to summarize, we went through the different types of variables and what are the different types of the table should be self-explanatory. We saw the right graph for the right data. We have to use correct use of central tendency and dispersion, because for mean we have to use SD, for median we have to use this thing. Then we have to check for the distribution of different variables. Data distributions wise, the test of significance will change. So remember, normal distribution is better, and if it is non-normal, try to transform to non-normal. Otherwise, go for non-parametric tests. So thank you one and all. I think I've given an outlay of what can be done in statistical analysis. So thank you, ma'am. Over to you.
Excellent talk, Dr. Parthasarathi. Such a vast topic you have to compress in 20 minutes. That way you are a little fast. And anyway, I think if only you had developed an interest and start learning whatever Dr. Pathsade has told now, your way of approach in reading an article or a paper, it is going to be an entirely different experience. And I'm sure all of us should learn that, especially when we are going to present a paper also. And there is one question in the chat box. Dr. Anandalakshmi has asked, can we find that data have been altered manually through standard deviation? Dr. Pathsade?
Actually, ma'am, for a trained eye, we cannot say whether it is manually done or not, but we can say there is some kind of huge outlier is there. See, if you are collecting data for 30 cases, 29 cases will be contributing for a mean. Suddenly, if you give a standard deviation of, if the standard deviation is very higher than mean, if the standard deviation is large, you say my mean hemoglobin of the population is 9 grams, 9.3 or 4, and your standard deviation is 5, then definitely your data is not normal. It means your data is spread a lot. Some values may be 15, 14, and some values may be 4 or 5, something like that. So the range is more. So if there is something wrong in your data cleaning or data, usually there is data typing errors. When we enter 9, you mistakenly press 9 twice, and your hemoglobin value will be entered as 9. Instead of 9.9, it will become 99. So that will be showed up in the mean and standard deviation. We cannot actually comment whether it is manually done or not, but by for a trained eye, for a statistician or for a community medicine person, by just looking at the mean and standard deviation, we can definitely comment whether your data is normally distributed or not. Because many times people take it for granted. They directly do t-test, they give p-value, and they finish the study. If your data is not normally distributed, you cannot do that. The journals will ask you what type of test you did to check for distribution. We are supposed to do, before going for parametric tests or p-value, before you determine the p-value, you have to do the initial step, which is either you do Shapiro-Wilks test or Kolmogorov-Smirnov test. So these kind of tests are easy when you do with SPSS. You just enter the variable. It will give you a p-value of whether your variable is normally distributed or not. That p-value should not be significant. If that p-value, if it is more than 0.05, you should be happy. So in some instances, the statistician is happy if the p-value is more than 0.05. It means for normality, for tests of normality, the p-value should be more than 0.05. You can note these tests: Kolmogorov-Smirnov test, Shapiro-Wilks test. For a larger sample size, we do Kolmogorov-Smirnov, and for a smaller sample size, we do Shapiro-Wilks test. So this is, we usually do it for these things. Thank you, ma'am. I hope I answered your question.
Yeah. Thank you very much. At times, some people do only for 100 cases and just multiply 10 times and then give the statistics.
In that case, standard
how do
deviation
you
will be very
identify
less.
that they have done such mischief?
The spread will be very less, madam. The standard deviation will be very less. So if the sample size will be 300, 400, the hemoglobin, the mean hemoglobin will be 10.1, something like that. And the standard deviation will be only 0.4 or 0.1. So in those cases, the spread is not at all. I mean, the same values are given again and again. So the spread is very limited. So somehow or the other, if we dig into the data properly, then we can identify the patterns. So that is there. Thank you.
Thank you very much for a wonderful talk. Shall we move on to the next talk? I think Dr. Hepsi is ready. Dr. Hepsiba, are you ready?
Yes, madam. Yes, madam.
You can. You can start. You can start sharing your screen. Yes, nice.
Seen, no, madam? Seen.
Yeah, you can
Yes,
continue.
Okay, right. So the literature search will give an effective search is a very important stage in writing the literature review. It helps to identify research question which has been previously explored. It uncovers the relevant knowledge and the research method related to research question. By doing this, we acquire certain skills of synthesizing and critical analysis of the published data. So why should we do a literature search? Because I already told you this is a very critical component of an evidence-based project and helps us to understand the complexity of clinical issue and gives you an insight. It provides the best approach and best available evidence on the topic. And without this step,
your evidence-based practice cannot move forward. It is the process of re-examining, evaluating, or assessing the shortlisted literature. It gives a clear picture of understanding one research project. So that for anything, there must be a purpose, no? So this is to review the theory, to state the problem, to know the methodology, to assess the need for the problem, to support methods, finding, data collection, to review what was done in the past and generate new ideas. So that is the purpose of literature. This has been dealt by the first speaker, how to take a topic selection. Suppose I'll give you one small example. I mean, not much this thing. Want to know awareness among adolescents. One person wants to do a project, want to know awareness about adolescents, about HPV infection and vaccine. As many teenagers are using their phone, she thought she will use an app to promote this awareness. So how do we do it? The adolescent is the population. The intervention is the mobile app she is using to spread the awareness. So she will use the comparative study between those who have used the app and those who have not used. At the end, how many of them had a vaccination? So we cannot be choosing a topic which takes longer time. So the time frame also is important. The next step is after selecting the research topic, the important task is to develop the research question. This also is done beautifully by the second speaker. And the research question has to have certain criteria. It should be feasible. You can't be taking some research which is not available. Suppose if I want to do a pre-implantation study, some studies, when there is no embryology lab and no infertility clinic, I cannot do it. So it should be feasible, interesting, and at the same time, it should interest novel and ethical and relevant. These are all the basic things we have to have it when you choose a research question. So how do we do the literature search? Now we have a concept. The next is the research question. Then we have to frame a keyword and the subject heading. Then we can go on to the literature search. So this is again an acronym. There are 5 steps for the literature search. Please don't get confused with that because that one and this one. This is little different. The Picasso is the plan using what we have developed, the research question, to formulate certain study, how we are going to do the search strategy for searching. And we have to identify a database to search and conduct your research in one or more database and select relevant articles. We cannot be accumulating and taking all the articles. And after collecting all the relevant articles, we have to organize. That is the Picasso. So we should know some technique, even for surgery, for everything we should know the technique how to do. We have to access the relevant information. We shouldn't simply blindly, we cannot access so many information. And it should have a less unwanted materials and the relevant information you should secure. And should be familiar with various techniques, that is the search engines. So many search engines are there. Now it has been very, very easy for you to do literature search. You need not go to from American library to British library and so on. There are so many search engines are there. So the search technique, again, you have to have your Picot question. That is the key question you formulate. And from that, you try to identify a keyword. A keyword, you can, similar synonyms or a subject headings you can identify. This will help you to determine which database so you have to use it. So there are so many database. See, look at this picture. There are so many search engines are there. The 3 big database we usually do is PubMed, Embase, Scopus are very 3 important things. We can even find out the number of citations and so on and how to filter. See, this is the modest list of resource and the web addresses. See, we usually these 3 things we do, Embase, Scopus. This
engine is for the nursing. A lot of nursing articles will be there. Of course, the Medline and PubMed we use more often. So now that we have identified pertinent database, we have to begin the search. And how that is the search with the keyword. So use the keywords. I already told you, you have to use the keywords which is identified from your question to start the search. Then it will become easier. If the initial search doesn't produce any results, you can play with them. Some more keywords you can add on. Then it becomes easier. Okay. So it is essential to use the targeted keywords. It should be specific so that you can pick up more relevant things. Then you define your keywords according to your concept. Then the next thing, you can expand the list of writing down synonyms similar to that. Yeah, adolescents can be a teen. Something like synonyms, you can pick up a keyword. Then also you can improve your strategy. You can improve your search. So let me tell the example. That is, for example, if the keyword you want to coin, that is the topic they have chosen is the adolescent to quit smoking using a support group and the nicotine replacement patch. So here I told you this is the strategy we are supposed to use. Here the population is the teenager, intervention is the support group, comparison is between the nicotine replacement and the support group, and the outcome they are expecting is to quit the outcome. So the keywords, what we will do is the keywords, for example, we should arises from, if the keyword, you can even choose a high school student, which is similar to teenagers. And when the article with a high school student, you can immediately download because it is almost equivalent to your key concept. So the different thing based on your keyword, different search engines will give different different combination. Like support group in Medland, it can even be a peer support. In Embass, it can be a support group. In Sinal, it can be a self-help group. And we shouldn't discard that. So it is not akin to your key concept. Similarly, it is based on subject headings also. So we can use the subject heading. See, your aim is to how many of them stop smoking. So smoking session or a quitting smoking. See, these are all the similar synonyms. You can use it so that you can get more articles from the different search engine. But you should know that not all search tools use the subject headings. And many a time only your keywords is it's more than enough. So this is again another technique you can use it. Phrase searching. Use quotation instead of simply putting a quitting smoking. You can add this quotations and nicotine replacement rather than within the quotation. You will get some more article to search. Another trick is truncation. You can add asterisks. See here, the smoke spelling is not all right, but we can do it because it can be a British or it is an American. When you put a asterisk, you can get all this written articles like smoke, smoker, smokers, smoking, like that. So you get more articles, easy to search. So when it is within the asterisk, you can get all these formulas and you can search the articles. Another interesting thing you can put in Medline, you can put both useful finding. And when you use this search, both British and American spelling, it can be used. There are different things we can utilize it. The keywords, you just manipulate. These are all the tips to search very easily. Another important thing is the combining search terms. So Boolean operators, they have used, that is, now it's the time to combine the search items. Suppose you want to do the smoking and the effect of the nicotine replacement. So you can add both smoke and nicotine replacement, or only smoke, or you need not add anything. So this is the example. So when you add and it only results that contain both keywords. Both, suppose smoking and the nicotine patch, it will give you articles with both the things. And if you add or in that search bar, if you add or, it will give the results will contain keywords either A or B. When you add the word in between not, the results containing only keywords excluding the others. That also is very important. We will not get an unnecessary article which is not relevant to our search. Okay. So this is the thing I was talking to you. When you use OR, that is R, your results will become narrowed down. When you use and, it produces a broader results. When you use not, it removes the previous unnecessary results, right? So this is the combination we were talking, our topic, the social, either social support or peer support or a support group. When you add, you can get so many articles pertaining to your search. So this is again a very important thing, filters. See here, you can see filters, you can filter including an article type, publication type. See here, you can, there are so many articles when we start searching from the 9 database, 317 articles. When we, but few of them are duplicating. So by removing that, you melt down to 298. Then based on the title abstract screening, again, it has come to 158. And then research focus, whether it is focused to your topic, again, it is melt down to the total. So you have searched 317 by removing the randomized trial, whatever if you want to know something about a randomized trial on your subject or a systematic review, by that you can exclude, and here only 135 research articles. Finally, that is called the filters. Okay, there are online things are there where you can use this Ovid SP users and all. It's you can create a personal account. You can have an access so that they themselves will filter, and it is designed by Cochrane collaboration. So you can trust that thing also. So here there is we are in very, very fast literature era. There are many databases that can give alert. Okay, there is a recent publication on your topic and you can take action. It gives you an alert. It can come to your email or your this thing, WhatsApp. This is very interesting. We all do this. See, there will, when you search one article, and next to that itself, there is a similar article, or below that, there will be a similar articles will be here. Okay. So you can search that. It may be useful or you may not be useful. Snowballing is nothing but if you have an article, at the end, there is a lot of research, nearly 20 to 30 references will be there. Then from that reference, you can search. That is called the snowballing. And here again, you have to search by hand to catch anything you have missed. It can also use to search sections, chapters. You can refer your topic in a chapters, and it helps you to pick up the material that might otherwise be missed. You would have missed if you have not searched in a book or in a electronically specific criteria in your mind, that would have been missed. So there are also databases to search this, whether it's this thing is perfect, whether it is from the index journal, all that we have to find out. Okay, this is again an interesting thing. We need to know about the citation of the article and citation of the author also, because you can find more recent papers on the similar subject. Usually the citation article, you can have an innovation based on that. It is always there. It helps you to make your literature review more comprehensive. Actually, whether I really don't know whether this thing is working. There is a citation, how to search for citation analysis in the Scopus. There is a video there. It is also available in the YouTube. All that you have to put this in your search bar. You have to write it, University Library Health Secretary, then it will go to, see here, there is a scopus is there, then you have to press that. Once you press that, it will give a lot of information. See? So here you have to write your, this thing, document. Suppose here you can see when you write a document, see? Then you have to go and search whatever you want. Immediately, the articles, it will give. How many articles are there? It will show it in the, see, 699. Then you can go for this articles, whether it is cited, citation. View the citation. You have to go for the citation. Then it will show how many, from how long, and each year, how many time that article has been cited. Similarly, you can find out for the authors also. The author's name you can pick up, and then you can, there is an archived idea. Idea is there, see authors, this thing. When you put the archived ID, it will show how many times this author's article has been cited. So that you know whether it is a recent one. See, the entire list is given by the author's citation. See, he has done 7,114 and his H index is 40. And the metrics, from this you know whether it's a valid and it is a new thing. You can choose whether it's a 2021 or 22, all that you can choose. It's very, very simple nowadays. And again, regarding the PubMed, it is a Medline, National Library of Medicine, NLM, premier bibliography database that contains more than 27 million references to journal articles from more than 5,200 worldwide journals in life sciences with concentration on biomedicine. There is also, PubMed contains citation for PubMed central articles. It is a archive that includes articles from journals reviewed by the Cochrane people. So it is a trusted thing. You can search that and indexed in NLM, medical subject headings. Okay. Here again, it is easy to pick up. There is a, you can all view this in the YouTube also. All that it is called advanced search. You can find out advanced search. So all the field you have to enter. See, the query you have to enter here. Whatever article or whatever your keyword or whatever this thing you can add here. See, they have added high blood pressure or hypertension. I told you know the Billingham criteria. See, we have added high blood pressure and hypertension. See how many results has come. Okay. So you mustn't be happy with that. So you can do some more. See, they have added the exercise and the physical activity on the high blood pressure and hypertension. Some more articles they have received, 5,900 and all. So again, you can do some more advanced search. So here the filtering is come, whether you want to know only the abstract or a free full text or, all that, the filtering also it gives. So you will know, you get an article which is specific to your subject. So having collected, we have to evaluate our search. There is one tip is that CRAP, the currency, relevance, authority, accuracy, and purpose. Okay. So currency means the date of publication, whether how old. See, we shouldn't always give the references before 5 years. So we have to give only reference. And the relevance should be your, according to your topic. That is the R. And authority, who is the author? I told you that is the reason for we are searching for the citation and H index. Is the author is qualified to write on the topic? I cannot be an author. I can be an author for a nuclear medicine, but I am not an authority. Like that, you should find out the authority, accuracy, whether it has been backed up by the evidence, or has the information been reviewed or referred. What is the language? All that is the accuracy. And the purpose. What is the purpose of information? Is it to teach or to inform? Sometimes some purpose, they even sell the idea. Do the authors, sponsors make their purpose very clear? So this is the craft test. We have to evaluate our own literature search. There are ways to restrict your search also, either to restrict or widen. And when you add more search, look for variation in spelling. So when there is an irrelevant thing, it is coming, you have to recheck. You have to go to your mentor and you find out, or you have to search more data. So in a nutshell, the literature search is a cycle. So you have to first frame the research question. You have to have a search plan, where to search, what to search, how to search, then evaluate and record, and the search results you have to review and refine. This is the cycle of literature search. So we have to improve. Are there a lot of irrelevant results and we have to delete all these things? Can I identify any real results in this? So all this you have to, then and there you have to evaluate and improve your research concept. So you have to organize your results. As you begin to collect articles during your literature search, it is important to store them in an organized fashion. There are, again, a search engines and a software are there to help you. They are called reference managers. But the way not to only keep articles and organized, but they also generate in-text citation and a bibliography when writing manuscript. We have to cite the reference. That also there is a software. So there are official number of reference managers are there. Zotero, EndNote, Mandely, and Papers are available. So it is available free for faculty and the staff nurse. So these are all the tools I was talking to you. They can then automatically they generate reference list and bibliography in various reference style. See, reference we have to give in a different Vancouver style and so many style. They all is taken care of the software. I think this is the model of reference manager. What are all the things they are doing? You can just have a view as the researcher. You can, it's very easy. There are so many official things. Reference managers, as I already told you, EndNote, Mandely, and that is all accelerate your research. They group it. See how nicely as you search, you can enter into the library sort of things, put all the research, all your article there. It will group everything. And then it can save in your email also. So this is the use of reference manager. So actually, if you don't use all these things, you have to save your search strategy then and there. So literature search is not one database. You can search all the research literature. There is a need to search several different databases or online resources. When searching topic of interest, emphasis should be given to meta-analysis, systemic reviews, landmark studies, etc. That is how we filter the articles. So something is systematic review, meta-analysis, it has got more value. So this is again a nutshell. Finding out research question, you have to focus, refocus. You have to have your search plan, resources, where to look for, search results. You have to review, revisit. Then you start the literature review. So unless you do literature search, you cannot write the literature review. There are 7 steps. As I am repeating, you identify your question, review discipline styles. You have to search literature, manage your reference, critically analyze and evaluate, synthesize, then you start writing the literature review. So, using these steps, you are really ready to start your literature search, I think. It's important to remember there is no right or wrong way to search. The literature search or repetitive process, it will take some time and negotiation to find out what you are looking for is very, very important. You have to repeat. You can always change your approach or the information research you are using. The important thing is just to keep trying. Keep on trying to get the relevant article, relevant information. Don't get frustrated. See, don't get frustrated like that. Keep smiling and you must keep on trying. So the literature search is a journey starting from question, research, manage, synthesize, then start writing. But you should enjoy the journey. So to conclude, everyone knows what search engines are available, but very few know how to use them effectively. So we do not know all the answers. If we know all the answers, we would be bored. We keep looking, searching, trying to get more knowledge. With that, I conclude. Thank you for patient listening.
Thank you, madam. Epsiba madam, as usual.
As usual.
யாரும் உங்களை பீட் பண்ணவே முடியாது. ரமணி மேடம்.
Yeah. நீங்க தான் சொல்லிட்டீங்களே.
Thank you. Thank you.
Thank you, madam.
Hope it was useful. Sorry for the inconvenience. In between, suddenly everything went off. Light.
Madam.
Thank you.
I think all topics over. எப்சிபா மேடத்தை திரும்ப நம்ம பண்ண சொல்லணும் மாசம். என்ன மேடம் எவ்வளவு எஃபர்ட் எடுத்து பண்றோம், நம்ம ஆடியன்ஸ் ரொம்ப கம்மியா இருக்காங்க, அதுதான்.
அது ஏன்னா எல்லாம் உட்கார்ந்த இடத்துல everything is available, but மாதா பிதா குரு கூகுள் தெய்வம் ஆயிடுச்சு. That guru gone. But sometime even this map, no, when we go on the road, it leads us to a dead end. Sometimes it does that. So we need
Super,
to have
madam.
Thank you. Thank you so much. Thank you.
We will meet tomorrow also. We will meet tomorrow again.
Okay.
Thank you, madam.
Thank you all.
Thank you.
Thank you all.
Thank you. Thank you so much. Thank you for the initiation. I should congratulate the entire team, Ramani, Sambath, and everyone. Okay then. Shall we leave?
Yes, madam.
Thank you. Thank you.
நாளைக்கு பாப்போம் ரமணி மேடம் எல்லாரும். Thank you.